So, good morning, everyone. Without further ado, let's start with the orientation on the CPHC NCD application today. Okay, so as you're all aware, in the year 2018, Government of India had announced the Ayushman Bharat program, which had two key components. First was namely the Ayushman Bharat Health and Wellness Centers, through which the government shifted its strategy from selected primary care to comprehensive primary health care. And it includes services for around 12 service packages under the Ayushman Bharat program, of which NCD is a very important element, is one of the key services which are delivered through our health and wellness centers. So over the years, we have seen that as the country witnessed the demographic and epidemiological transition, around 60% of the mortality can be attributed to the non-communicable diseases. So under our health and wellness centers also, a population-based screening is being done, in which five key NCDs, namely diabetes, hypertension, and three types of cancer, that is oral cancer, breast cancer, and cervical cancer screening and subsequent diagnosis and follow-up is being done. So this program is being rolled out across all states and union territories in the country, and the target population of NCD screening is population 30 years and above population, which comes to around 37% of the population residing in the catchment area of the facilities. Is the audio not clearly audible?
Well,
We
ma'am.
can hear you.
Okay, all right, thank you. So now this CPHC IT, talking about the CPHC IT application. So as we were discussing that the field activities, program activities are going on our facilities, but it's equally important to capture it on the different IT applications and portals which are there. So under talking about the CPHC NCT application, it is a group of around six interrelated applications which covers the entire spectrum of service delivery, right from the community to the primary healthcare facilities, namely the sub-health centers, the primary healthcare centers, to the secondary healthcare facilities, the CHCs, district hospitals, and then there are also admin and program officials applications. So we'll talk this in detail. I'll just briefly give an overview of this. So under the Asha application, there are provisions for Ashas to make entries for population enumeration and CBAC assessment. Thereby, when the individuals on high risk are identified, they are referred to the primary healthcare facilities for screening and subsequent diagnosis. So there is another application for ANMs and CHOs wherein NCD screening is done and that data is recorded, and subsequent follow-up data is also recorded, and the data is entered by the CHOs and the ANMs at the sub center. Then there's another application which is there for medical officers and our staff nurses, which capture details of diagnosis and also around the treatment parts for the all the simple cases of NCDs which are diagnosed. Then the cases with requiring more nuanced treatment who are referred to specialist care for, at the secondary healthcare facilities at CHC and DH. Those details are captured in the fourth application, which is meant for the specialists and nurses at the secondary healthcare facilities. The fifth component of the this application is for admins, which basically manages the users and the facility accounts. And the last application, and in fact the portal, the dashboard, is meant for all the program managers who can see the performance of the program. So there are dashboards for them to see how the program is performing with respect to different diseases at different levels, and accordingly, program decisions and changes could be made. So this application and portal system fulfills many objectives. When we talk about the as far as individuals are concerned, so this application captures line listing data. So most of the portals which are run today in the public healthcare system, they basically capture aggregate level data, as is seen in the case of ABHWC portal or the HMIS portal. But CPHC NCD application is unique in the sense that individual line listed data is available, which is very important to track the progress of the individual through the different levels of care. Then, secondly, as far as service providers are concerned, this application system increases, enhances the productivity and the quality of care which is provided at our facilities. So there are protocols with decision support systems for hypertension, diabetes, and the different cancers. It also helps them in standardizing the quality of care which is given. Uh, Lastly, it helps all our program managers and the health officials at the state level, at the district level, to provide timely quality data is available through this system, which helps them to take decisions accordingly for the program. So there are a host of dashboards, analytics, which can be seen, monitored, and decisions be taken by them to enhance the program's performance on field. So this IT system has been rolled out since 2018. So as on date, it is being running in around 31 states and UTs, except for Andhra Pradesh, Telangana, and Kerala. And two of the other states of Himachal Pradesh and Tamil Nadu are currently in the process of moving on to the system right now. So around we have data of around 22.5 crore people which has been enrolled on this system. So that's a huge data which is available for the country to monitor the progress of NCDs. Around 5.4 crore individuals over the age of 30 have been screened for NCD successfully and have been registered on the portal for that. Around 593 districts are using the system right now. As we were seeing, there were multiple applications for the different cadres of service providers. So as on date, 1.5 lakh healthcare workers have been successfully boarded onto the system, which includes around 25,000 medical officers who are using this. And Tata Trust and Dell teams have been supporting in the training and in the regular day-to-day technical functioning of this system. So around 98,000, more than 98,000 individuals have been trained across the state and the district. There's a regular support system which also looks after the training and the hand-holding of state and district level officials of the CPHC IT system. So we can see this IT system is been rolled out throughout the country and has a huge potential in the coming times also, wherein when all the targeted population for NCDs are boarded onto the system, so this would be a very useful resource for the country for planning for the NCDs, which as we are seeing are now the major killer and are attributing to the major mortality in the country. Now, I'll request the Tata Trust team, Mr. Sunish, if he'll just take us through the details of this system and give us also a demonstration of the different applications of the CPHC IT system. Thank you, Mr. Sunish.
Yeah, thanks. Can you hear me?
Yes, you're audible.
Okay, good. So, good morning, all of you. My name is Sunish, and I'm part of Tata Trust. I'm being joined by other set of team members. My colleague, Dr. Prashant, is there, and from Dell we have Pinky and Karthik. So, in today's session, we will we will run you through the existing applications and the overall software which are being used on the ground. So, as informed earlier, there may be scenario where you may not be able to ask questions immediately, but you can post your questions, and one of us will respond to that. And then later on, towards the end, we can open it up and we can take your questions. Okay. So just feel free to ask any questions. Okay. So I will do one thing. Thanks to Dr. Bala and Dr. Neha, they have given good background and covered the initial thing. So as informed, what we have is we have this different level of softwares at every level. Asha level, we have an Asha app. At ANM and CHO level, we have another app for their level. So what Asha's role is, maybe just a minute, I will try to project that particular screen again and try to show it. Yeah, so my screen is visible. So this particular screen, what you see is the NCD workflow. So what you can see is that the first one, the population enumeration, the entire PBS starts with the population enumeration, which is done by Asha. So what Asha basically does is she will have family folder and CBAC, risk assessment form, which she fills in using her device. And then any suspected cases from there or any 30 plus, everything has to be screened by NM and CHO at the next level, which is point number 2, what you see here. So here at this level, we have a mobile application, which has recently been launched, and we have a tablet-based application, which is being used for last 4 years. And we also have enabled this particular screening in MO portal also. I mean, in case if there are users, I mean, pan India, we have multiple set of users with multiple issues. So learning from all their issues, we thought it'll keep it open at all the 3 levels. And that is why these 3 modes of using the data is being opened up actually, right? Then from ANM level or CHO level, any cases which you suspected cases after you do the screening and examination, whichever suspected cases you feel has to be referred to the next level for MO examination. Okay. So MO at PHC, by thumb rule, the first point of referral will be your MO at PHC. MO PHC will do his or her examination, and if he or she feels that the person needs a treatment or it's a confirmed case, they will put them on the treatment as per the guidelines prescribed, under NPCDCS. The treatment will start based on the protocol. So the software captures the entire protocol, whatever is mentioned in your NPCDCS guidelines. Then it goes back again to the ANM level and Asha level for follow-up. Now, this entire process of to and fro is called care continue, right? And that is what we are trying to ensure by using this entire software. So the ultimate purpose of this entire exercise is to ensure care continue for the beneficiaries or for the people who are under the medication, right? Then from the 4th level onwards, 4th is again we have at the specialist level also for the secondary level at CHC and DH level. All the complicated cases can be further referred to that level also, for further diagnosis to get a confirmation from the specialist care. And this, it can always come back for follow-up at the primary level, right? So this is the flow, the step 1 to 4, what you see in the diagram here, right? Point number 5 and 6 is basically for the people who are the administrators or the monitoring officers, at the state level and the district level, even at the national level, to see the performance. So point number 4 is admin. So we have an administrative portal wherein all your user IDs, your mapping, adding the villages or whether the subcenter or the HWC is falling under the correct PHC or not, that entire mapping, though we have the metadata there, but in case there are still cases where there is mismatch. So that can be sorted at admin level. So your district level, the point in contact. So you can reach out to that person and we will get it sorted in the admin portal through them actually, So they are themselves doing it, creating your user IDs, changing your mobile number, okay. And many a times, OTP, once you log in or change your user ID, OTPs was a major problem. Then this was learned from the field. We enabled that OTP in the admin portal. So during your login, many of you must have encountered this situation and must have fetched the OTP from admin. So that is the purpose of admin portal. So at the district level, it has been accessed by the person in charge there, right? Then the next level is for the program officials at the district level and the state level and the national level to access the dashboard and to see the performance as to which village or which Asha or which sub-center HWC is performing, how many records has been entered. If they are not able to enter, what are their problems? It's basically for all your policy making on your monitoring purpose. So that is why this performance dashboard is there. So this is the entire workflow which we have been using it for last 4 years, right? So the data can be accessed at any of this level from Asha to specialist level, and it can go back to the Asha level in that hierarchy, right? So what we will do now is that we will go step by step and we will give a demo of each of this software, and then we can take up your questions and then we will address your queries. Okay. So I will start with the ANM application, Asha application. Are you able to see my screen? Yes, I can see. I'm logged in from other device also. So this is how your Asha app looks like. Okay, before that, I would request Prashant, Prashant, Pinky, and Karthik, just check the messages or the chats. If there is any question, please try to reply them. Or if you feel that I need to interact or you need to pitch in here, you are free to do that. And we will
take note of questions. You continue.
Okay.
Sure,
fine.
will do, Sunish. Yeah.
Okay, fine. So this is how the Asha app looks like. Okay, so as you see, this is a version 3.03. I'm using the training purpose one, which usually we use for the demo one. User IDs, you all know we take the RCH one, so to avoid any confusion in the field. So wherever it is available, we use that. I am in the second page basically. So first page, you all must have exposed in your CHO application. Also, we have a username and password state in the first time login, that all those things gets saved. Okay, auto saved. So you have to just enter the PIN. So we have a 6-digit PIN. We enter it and we log into the next level, which is my.
Sorry to bother you, Mr. Sunish. Just an announcement here. So we
Yeah.
are also doing a live YouTube streaming for this training because it was reported that many of the field functionaries couldn't join in for the WebEx link. So I'm
Okay.
just I'm giving that YouTube link in the chatbot, and the state nodals can communicate, share that YouTube link to the primary healthcare team members if they are facing any issues in joining in on the WebEx platform. Okay.
Okay, sure.
Yeah, sorry. Now you can just continue.
No, okay, no issues. Yeah. Okay, so this is how your landing page looks like for Asha. Okay, so as I said, it's a demo app, so that's why the population I've given 1500. But in whatever the real life scenario is on the ground, it could be 1000, 15, 2000, whatever, it can be feeded. So I'll show you how we can do. So the first thing what Asha sees here after landing is on the top her name. I mean, basically her user ID she can see. Okay, and then she can see the dashboard. So this four box, what you see, the green, yellow, and red color is basically her dashboard. She can see the total population of her village, which can be fed from the ANM CHO app. So CHO or ANM can define the population when they are in the subcenter profile or HWC profile. When they are entering the villages, they can define the population there. That I will show you in the next level. Right. So here in the dashboard, they can see these four things: enrolled, pending action, follow up, and lost to patient. Okay, so what does enrolled means? Okay, I'll get into this detail. And the third segment, what they can see is the enrollment and the village profile. And the last thing, what they will see is a sync button. Okay, on the left side, there is nothing here. It's plain. The reason why I'm highlighting it, when I start using the application, you will see certain changes here. Okay, so I'll let you know what is that particular change. So the change is basically you can see how many records you have edited, and then it will show up there, and you have to sync it once you start using it. So in nutshell, number one, it's an offline app for Asha. online is required when you are logging in for the first time, right? When you are updating the app, you need to be connected to internet. Okay. Third, when you are syncing the app. So these are the three occasions when you need to use online, be it an Asha or CHO or A&M app. So you need to, internet is required in these three places, right? And it's an auto sync. Basically, the moment you log in, if you are not synced, so it will automatically start syncing the earlier records. Depending upon the internet bandwidth and the speed, sync can be completed from 30 seconds to 2 minutes or 5 minutes, or depending upon the internet speed and the volume of the data what you have. If you have 500 records and you want to sync everything in 1 minute, and you don't have a good internet, it will take time. So, or it may crash also, because at times that also happens. We have learned these things from the field, right? So these are the critical features for Asha. And what are the major roles? Asha has to do three roles. Number one, she has to enroll. As I mentioned, she has a family folder and a CBAC. So she can do all the family folder and enrollment of all the population of her in her vicinity and close it. Okay. Then once she does the enrollment, what is her next job? Then she has to do the follow-up in coordination with her CHOs and ANMs. There may be many cases that has been referred by ANM but has not gone to the PHC, for their examination, or the patient is under treatment, right? And ANM is for some reason are not able to track the patient. So Asha is at the village level, so she can help that respective ANM and CHO to track that patient and update the follow-up. So that can also be viewed in CHOs or ANM's tablet, right? So these are the basically critical features what Asha will do in the software, right? So first thing I'll do one thing, I'll start with enrollment. So what Asha does is that she clicks on the enrollment here. There are certain mandatory fields which will be marked in star mark, asterisk. So this is a common thing everybody knows by now. So she has to select her village, so she can see only her village name. Okay, this is the typical family folder and CBAC form. There is not even a single field changes what you have in the physical hard copy, right? So in fact, okay, when I come to CBAC, I'll show you. The entire application, if you see, there is no need to type anything. This is by default populating subcenter name and PHC, because she has logged in and the mapping was already there in admin portal. So automatically this thing comes there, right? Then comes your family folder. Family folder is the same thing. They have to enter the house number, right? They have to, let's say, put the name of the household. Okay, so that is where you have to just type. Otherwise, all the other details, for example, type of household. So you have an option to select. It's a multiple select option, right? You can either select one, you can even select multiple. Availability of toilet or drinking water. There are multiple sources of drinking water at home. So tap, well, or river or whatever. Say okay and press it. You can select one also, and let's say electricity supply, okay, and select it. So the idea is you have a checkbox like this, and you have address you have to fill, you have to type it out. Mobile number, you have to definitely capture it, and it's strongly advised to capture the mobile number. Then you save it, you go to the next level, okay, where you have the option to take the picture of the individual, okay. Picture of the individual also helps in when the patient goes to the next level at the, let's say, CHO or NM or at MO level, when they fetch the record, it will be very easy to identify the patient, because Mala is a common name. There will be 10 names on the ground, right? But how do we identify it? So there are multiple sources where we can identify it. Photo is the best option, right? Name automatically gets pre-populated. ID, there are set of 4 IDs, government IDs, which you can fill in basically. Date of birth, either they can fill the date of birth or age. Generally at the village level, they may not remember the date of birth. They will randomly say, I am 60-year-old. So you can just write this number itself, so the date, month, year will automatically pre-populate, right? Other details, and then you have the second option like this, you have to select whether it's a male or a female, and a radio button option. So the entire application will comprise of these options actually, right? So I'm not filling the non-mandatory field in the context of time what we have. just putting in the mobile number and saving it. So this is how your family folder gets filled. Now you see the family member is added. CBAC we have not filled. So you see a small box here, which basically shows the person's name. Let's say Mala here. I put her age, her gender, and the mobile number. CBAC has not been filled. That's why you see this red color small tiny mark is here, right? Had I taken the pic photo, the photo would have come here. Okay. And this is how you fill the family folder. Now, after filling the family folder, there are other members in the family. So in the family folder, we can fill all the members in the family, be it 100-year-old or a 1-month old baby. There are certain states or districts I have seen the trend is only to capture 30 plus. I would request all, family folder is a very powerful tool, and CBAC is a very powerful tool. And this is one of the few programs where you capture the entire family in one go. So when you are capturing or at the ground level, please capture everything, 100-year-old also or 1-month old baby also. So how do we do that? I'll let you know. Just click on the add button here. You see a person's icon here, small one. Just do the plus button here. Add the second family member. Let's say whatever. Okay. I am not filling other fields. I'm just putting the age. Okay. Male. Mandatory fields I am filling. Going down and saving it. Do you mean this? Okay, because already there is another person. Family members. Now you see the second member got added, right? Now this way you create the family folder, right? Now after family folder, what needs to be done? CBAC. So you have to click on this name Mala, okay, and then you will see this page. What you see on the scroll. You basic information will be given, which village and which taluk and which PHC that person belongs to. Family folder individual enrollment is already done. That's why it's in dark blue. And CBAC is not enabled because we have not done it. So what we do is that we click on the CBAC and then it gets opened. So now CBAC gets opened. So in the field, we have learned that still there are people who are using the old CBAC form. Still there are people, there are people who are using the new CBAC form. So we have given both the option to avoid the confusion. We have given both the old CBAC form, which basically has this 5 sections, what you see. In the newer sections, there are 2-3 sections which got added, which is basically mental health and geriatric care related questions has got added, right? So I'll just click on the new one. Date is mandatory. It starts with, the question here. General information is already pre-fed in the earlier screen. No need to repeat the same thing. Personal details is about that individual Mala, which I have just enrolled. So it's already pre-filled. Then basic work starts from your part A, B, and C, part A to D for the CBAC. So part A is your risk assessment. Some things are already pre-populated age. These are typical questions about the part A risk assessment form, alcohol consumption, yes or no. So if you see on the right side, the score gets automatically populated. You need not type the score. Okay. So the moment you put anything on the high risk category, the score goes up. As you see, it is gone up to 2. If I do 80 or less, it will be 0. Okay, physical activity. If I do, if a person is active, is good. If not, then the score will go up. Okay, so this is the way you have to fill the CBAC form. No typing business. Just they have to press the radio button and yes or no, and then press it. Now you see the score has gone up 5. So anything above 4 needs to be immediately prioritized for screening at CHO or NM level. Now part B. Okay. Now part B has 2 sections, as you all are aware, for men and women, and women only section. So this has questions related to not only this 5 NCDs, it has also TB related questions, leprosy related questions also will be there. Okay. So you have to do yes or no. Since it's all these are mandatory field, so Asha cannot skip it. So at Asha level, we have made this as a mandatory field. You have related to visions also, eye related issues also, hearing also, as you see, so they have to do either yes or no. If I leave any field unfilled, I can't go to the next level. So at Asha's level, it's mandatory, but when the same screen, when it appears for CHO or NM, it's not a mandatory field. So I can show you there, right? So this is how basically Asha has to fill the thing. Now this is only women section, basically questions related to the breast and the cervical part. They have to just examine and ask them and fill it. I'm sure they are given this 5 days training there. And during those trainings, all those things are covered, okay? Third section, as I said, the geriatric care, the elderly specific questions has been introduced. Here also the questions related to the senior citizens, whichever is 60 plus, that questions you need to ask and fill it. Third one is, COPD, it's exposure to your, the like crop burning, or if you're staying near a factory and all, that also affects your breathing ability, right? The last one is related to your mental health, okay? So there are a couple of questions related to that. You have to just, and it's a drop-down option, huh? It's only one question has to be selected. Based on that, you can select any one of the options. So here also there is a score. So depending upon the options you choose, the score gets populated. After doing all those things, this is how the CBAC is filled. You have to finish it. It will ask whether you want to submit and say yes, and the CBAC form gets filled. So this is how the CBAC form gets filled for that individual, right? So you can see the screen turning blue, right? So I'll go back to the home screen now. So this is how the enrollment is done. 30 plus CBAC is done. Now, before I entered into the enrollment work, I told you the screen is empty. Now you see there are records pending too. That means I have created two individuals profile there, okay? So the system prompts me, gives me a reminder key, you have to sync these two records. So that is one smart way to remind people, right? Then second element is village profile. This basically gets populated from the A&M level or CHO level once they enter the sub-center profile there. Third element is their work plan. Let's say enrollment, let's say the dashboard, okay, and work plan. So the dashboard is, see how many enrollment I did. Out of my 1500 population, I enrolled 176 and this many needs to be enrolled. Now, if she wants to know who are those people, so they can click on it. They can see a line listing of all the patients here and click on the name and they can go back to the that particular profile. Now, if she wants to see, CBAC above 4 or early detection. So all these 4 options, they have to just click and they can see the line listing of that particular individuals, right? So pending action, follow-up and loss to patient basically falls in her work plan. So let's see, she wants to know what are the actions she has to take. So enrollment is not like every day she has to do. One time she does and next time onwards, next year onwards, she can just update that records. So she has clicked on the pending action. She can see how many pending CBAC. She has enrolled the patient by individual, but she has not done the CBAC entry. So she can click on see line listing. Kitne sare log hain? I mean, whose CBAC is not filed. This person I just created enrolled, but I didn't fill the CBAC for this person Raja. So that's why it's showing here. So these are the filters. The blue button, what you see in the bottom is the filters. I close this week, so all those things will open up, right? कि कितने लोगों का pending है CBAC हमारे पास, right? So similarly, follow up. So as I said, follow up is an important action. And if they can see, how many controlled and uncontrolled patients are there in their visit, and they can click on that and they can see the line listing of those individuals here, right? And they can, so what is the action? Seeing is fine. Ab karna kya hai Asha ko? So what will Asha do? Asha kya karegi? Let's say this Amit patient is there. Click on this plus button. Say and so date I visited that patient. And what is the action I took? ओके तो एक्शन ये है कि हमने उसको वापस से बोला कि यू गो टू द सब सेंटर, यू हैव नॉट विजिटेड देयर, you go to the health facility, or the person will say I have visited a private facility, so she can mark there. The person is migrated to other place, which is a very common phenomena in the rural sector, or the person is not willing to access any service or not reachable. Any one of them they can select, okay, and then use it and close it. So that action is taken by her, okay? So this is how she has to do the follow-up. Loss to patients, these are the patients or the individuals they have referred. A&M has referred or CHO has referred, but these guys have not reached to your next level, which is PHC level. And that's why it is coming in that particular page. So last two positions can be seen like that. So this is the critical fields of the actions what Asha has to do. Okay, and I have explained already all those things. Language, we have 11 languages right now. Okay, so you have Hindi, Marathi, Tamil, Telugu, Gujarati, So how it functions is just click on that particular name, your field changes. As you see, this is an Hindi form now. Similarly, based on whatever your requirement is there on the field, you can do. Okay. So typically, I mean, off late, what we have seen is that we have seen the acceptance slowly getting picked up in various states. Karnataka, we have a lot of Ashas using. We have around 25,000 Ashas using their own personal devices, and they are logged in, and they have done, at least 40% of the enrollment in the state has been contributed by the Asha population, which is a phenomenal work. Rajasthan is picking up. Similarly, there are other states which are piloting, and slowly, they are also picking up, so that's how it's working. We have encountered all these typical questions. I'm sure you must be asking these questions also, like our Asha is illiterate, they may not be able to do it. But it's not that your 100% of Ashas will be on the same segment, right? Even if you have a 30% Ashas or 40% Ashas who are able to do, that will bring in a lot of efficiency in the system. Efficiency in the sense, like if all this population gets enrolled the next level, it becomes very easy. The workload gets reduced at the next level. The next level has to only screen and do the proper examination, the medical or clinical examination, what they need to do, they can focus on that. So it brings in a lot of efficiency in the system. And that is why this app is important, right? So hopefully maybe 2 years or 3 years or 5 years down the line, we can see a lot of developments happening on this segment. Towards the end, okay, what they need to do, as I said, the record pending sync is one, because in between auto sync happened. So my 2 records got saved. I need to press on the sync button, the 2 arrows, what you see, click on that, the data gets synced. If it's a very minimal records, under 30 seconds, it gets synced, right? So this is how your Asha app is used, okay? I am done with the Asha app segment now. Do you have, I'm sure there must be doubts or questions being asked. So any questions which need to be addressed at this level, Prashant, Pinky, or we move on to the next level, which is your CHO or AML?
There are questions. We have answered almost everything in the chat room, but what we can do is we can repeat those questions for the larger public. Okay, so I can brief the questions accordingly and answers could be given immediately.
Okay, just ask 1 or 2 questions. We'll take a couple of questions now, and then we will take up.
So I will summarize questions. I have noted down all the questions raised in the comment box.
Okay.
Okay.
Can you please go ahead?
Yeah, one was regarding the language. So you have already told that 11 languages currently we offer, and others also can be incorporated as and when required. One question was there that sync issues they are facing. So for that, you already told that first they need to check the internet. There may be syncing happening in parts or parcels. If still they are facing the issue, they must check if their version is latest or not, because in older version syncs get stopped. Okay, and auto update is possible with the help of Play Store. One question was there, from where they can get the Asha IDs. So for that,
1 minute. That second question related to the sync, one common issues observation what we have seen from the field during our visits or whatever, during our discussions with multiple stakeholders, Ashas tend to sync, not only Ashas, at A&M CHO level also we have seen, they tend to sync all these records of, let's say, 500 or 1,000 in one go. Could be any reason, internet is not available, or they are not able to do it, or they're busy with whatever. But you need to tell them on time to time, please, whenever the internet connectivity is there. Usually the trend, what we have seen from the back end, there are a lot of sync activities which happens in the night actually. Probably they go back home or whatever. I mean, they get a better connectivity back home, so they try to sync it. So we see a lot of sync happening in the evening and night time. So encourage them not to pile up a lot of records, so try to finish it off as and when the work is done, maybe in 2-3 days time. So it becomes easy for the Ashas, for the ANMs and CHOs and the district and the state official, otherwise typically I've seen in the WhatsApp groups and all this, they will repeatedly ask this question. So please understand the logic why internet, why sync happens, and there are certain places why sync doesn't happen. So it's very important to understand the logic why it doesn't happen. So it will be easy for you to handle the situation. Yes, Prashant, go ahead.
Yeah. Next question. Many of them have asked that one thing is either their Ashas are illiterate, or second thing, from where their Ashas do not have Android phone available with them. So this is the very common question being asked.
Yeah, this is a very common question. I totally agree. And I'm not expecting that all the Ashas or all the field workers will have the Android application or smartphone with them. But there are certain states they are procuring and giving to them. If they're able to use their own personal device, it's well and fine. Otherwise, the paper format still goes on, and then they can give it to the CHO ANM level also to get those things entered. And then the standard thing, what we are already doing, even in the portal, they can get it entered. So this could be the response actually.
Sure. The next question is how to delete the duplicate entries.
See,
So
duplicate.
that has already been answered, that at the level of Asha won't be able to delete the duplicate entry, but at ANM or CHO level, they would be able to delete the duplicate entry, but only if no further action has been taken, like diagnosed or under treatment. Those cases who are duplicate entries but not diagnosed or under treatment can be deleted.
Yeah, so basically the beneficiary, once he is created and some action has been taken by higher facility, right? PHC, CHC, DH onwards, if that patient's record is actioned by the higher facility, then you cannot delete it. Otherwise, if it is not actioned at higher facility, it can be easily deleted at the ANM CHO level. So we will show that, Sunish, while doing the CHO app, we'll show it. The search results, we get that option, right? We'll show it to all of them.
Okay, fine. So I've just logged into, just shared my screen for the next level, which is CHO arena. If there are still questions, one or two we can address, otherwise we can move on.
Yeah, I think just one thing I would like to reiterate is that CPHC HWC app, it is available on Play Store. It is just one app which everybody has to install, be it Asha user, be it ANM, MPW, CHO. It is just one app available on Play Store which you install, and all of you will have different login IDs, like all cadre of users will have different login IDs to access these application, and based on their login ID they will get their respective screens. What Shunish has already shown you for Asha, similarly we'll now run you through the CHO app. So it's just one app available on Play Store, and it can be easily updated. If any updated version is available, once the Play Store version is installed, it is next time onwards just an update, but only for the people, since before Play Store there were a lot of devices who were using the local version of the apps, right? Only those people, if they want to install the new version, they have to delete the older version and then install this new version from Play Store. So that is a one-time activity which has to be done by the users when they migrate to Play Store version. Thereafter, it will be always an app upgrade, just like any other mobile app.
Okay, fine. I think there is a hand being raised from NHSRC.
No, Sunish, I had raised it earlier when that announcement had to be made.
Okay. No issues. Fine. Okay, fine. So now what we can do is that we can move on to the next level, which is your CHO ANM application. We will run you through this particular thing. So what we'll show you is that now Asha's level, we enroll this individual called Mala and her husband Raja. We'll try to pull those records and show you the journey, how the care continuum can happen. So Prashant, would you like to drive this session?
You please continue. I'm noting down questions for this also.
Okay, fine. So the version what you see on the screen is the login page. So again, this is available in your tablet version and mobile version. So what I am showing you is on the mobile version. So if you have a mobile phone, smartphone, you can download from Play Store as mentioned by Pinky and then start using. Please be careful. I am using the training purpose. You have to use the live version. So don't get confused. There will be both training version and the live version. So you have to use the 3.03. So in that, it will be called as CPHC HWC. You know, if it's a training version, it will be called as HWC training also. So don't get confused. So in Play Store, please use CPHC HWC application, right? Login page rules is the same: state, user ID, your password, login. Whenever first time login, it will ask. Whenever you are logging into the second time, only you have to enter the PIN as you have seen in the screen. So enter your 6-digit PIN, whatever you have created. Login, you land on your home screen. So this is your home screen, right? So home screen, what is that you see? You know, on the top, you will see your username, ID. You will see this arrow button. This is nothing. It's a sync button. Now sync, since it is successful, it is showing green. If it's failed, it will turn into red. Okay. Then the second button, what you see is the search button here. So you can search the patient or the individual by their name, ID, or the mobile number, right? And third is you can add the new member. I mean, the current scenario in most of the places, what we see is that family folder and the CBAC is being entered. It has to be entered by CHO and the ANM by clicking on this thing. Then at the bottom, you will see your the hierarchy, district or PHC or subcenter which you fall in. So this is the mapping, what you can see, and the version number. On the right top side, you can see that this 3 button, this is basically your menu. What you can see there is the dashboard, the sync status. I mean, the list is there, the language options and all. So language option is same 11 language support what we have seen in the Asha. I am repeating again, it's an offline app. Online is required for 3 purposes: fresh login, updating, and syncing, right? Other than that, everything remains the same, right? Subcenter profile. So this is what I was mentioning there. I'll start with subcenter profile. Sorry, I'm clicking on that. So subcenter profile, what you see is that the which place state you have been registered. So this is a hierarchy you can see. You can the villages what you see here, it again comes from the admin portal. I'm saying the metadata, it's already loaded in the backend, so you need not worry about it. It gets automatically downloaded. There are scenarios where new villages are created or the villages are wrongly mapped. You have to inform your respective district in charge. From the backend in the admin portal, they will do the necessary changes. If they are not able to do, we are there to help them, right? So here, if you need to add the population, let's say village 3, I'm taking an example. So on the right side, you will see a pen button. That is basically an edit button. Click on it. You know, you will see one box like this, right? Put in your population, whatever that village has, 3,000. Add it. Now you see the number change from 1,500, it changed to 4,500. So this is how you define your total population here. And the target population is 37%. Automatically, it gets calculated from the backend, right? The same thing is what Asha will see. For example, in village 3, that Asha, when she logs in, she can see the 3,000 population in the top on her login homepage, right? So this is how you do the population setting, right? So I'll go back to the home page now. Okay, after the thing. So scenario 2, there are 2 scenarios here. I'll explain. Scenario 1, where Ashas have done your enrollment, right? She has just fed the records here. So before fetching that record, I'll do the sync here because I have to fetch the record from the Ashas what they have done it, and then I can be able to pull the record. So I did the sync is successfully done. Scenario 1, I'll pull the record Mala. Okay. Scenario 2, where I have to enter the family folder and CBAC. I'll come into that later. I'll start with the scenario 1 where Mala has been enrolled. So the person Mala has been registered by your ANM. The moment you start writing the names, the first letter onwards, you will see the line listing of the patient, individuals. So I'll go to the Mala, click on Mala, see the name comes here. Okay. I click on the person, had the photo been taken, photo would have come. So this is the profile. Okay, so you can see the family folder being filled by the A&M. Okay, if you want to edit or change anything here, you can definitely do. Let's say mobile number is not filled. You say who is the owner of the mobile number? It could be the head of the family or neighbor or whatever. So they will say self. You made the changes here. Okay, and similarly, if you want to add ID and all, you can always do that or save the record. So this gets saved. And then we go to the next section. On the top, you see, family, profile, screening, summary, and general. The last, when we searched that patient, we landed on the person's profile. Okay. Now, you may have a confusion. I mean, if I am a CHO, I'll have a confusion saying कि नहीं माला तो बहुत सारे, how will I confirm it's the same माला? तो मैं क्या करूँगा? I'll go to this next button which is family there. I'll click on it. I'll come to know ये कौन सी माला है, उसका husband कौन है. I mean, if the entire family details are recorded, you'll be able to probe this by asking couple of questions. आपके परिवार में कौन है, who's your husband name? So you'll be able to come on the correct person actually. So that is one of the smart way to identify whether the person is the correct person or not. Then obviously, if you are putting the family number, health ID and all those things and trying to fetch, you will get the correct detail. So I will skip the family. I've shown the family profile. Now I'll go to the screening section. Screening, the CBAC was done by the Asha. So you see the CBAC section is completed. All the other boxes, what you see is not started, right? So hypertension, diabetes, if you see, it's all disabled now. I cannot do anything. It's in gray color. The three blue color blocks needs to be filled. For example, personal history and the examination. So I click on the personal history. For me, height and weight is important. I put in the date, mandatory fields. I put in the height. BMI automatically gets calculated. Save it. So this gets saved, and on the top you see it shows completed. Then my other section gets opened up. Hypertension, diabetes, and all those things. During your probing or examination, you want to fill the personal history of the individual. You can always click on that and go back and ask the questions, whatever is mentioned here, right? So I'm not getting off in each of the screens, right? So I'll directly go to the screening part, which is here for 5 diseases: hypertension, diabetes, oral breast, and cervical. So I click on the hypertension part. This is how your hypertension screen looks like. Date is mandatory, okay? Obviously, your readings has to be mandatory. So you do the reading of that individual using your BP apparatus, be it a digital one or mercury one. I'm not sure mercury one is being used. So let's say you are using whatever the readings you see. So you go and enter. Okay, the reading is normal. I'll write it as 120/80. Now, if you put a reading which is above the cutoff level, above as prescribed in the guideline, let's say it's 145. The screen turns red. That means it gives you an indication this is on the higher end. You need to send this person to the next level for getting the examination done. Okay, enter the pulse rate, and has other 3 questions. Has they been diagnosed earlier? If they are diagnosed earlier, under treatment question will pop up, right? And now even if you try to save the record, without referring, the system will prompt, look, this person needs to be referred. It's on the high risk case. So you have to say, okay, go to the refer page. Even after saying yes, you go and save it, it will again ask the same question. The red mark you see on the screen, that means you have to refer. So as a thumb rule, PHC is the first place you have to refer. Select the PHC, save it, go to the next level. So this is how you fill the screening page. So on the screen you see the status gets reflected as referred here, right? That means you have referred this person to the next level. Okay. In the similar way, what you can do is that you can do the diabetes screening. I'm not getting into the details here. It's the same set of screen. You have to put the date, your RBS value, and whether it has been diagnosed earlier or not, and refer. The funda or the refer step in a refer and next refer to remains same at all the value chain, be it Asha, A&M, CHO, or MO, right? So it is a standard step. So I'm not filling this field. There are other 3, which is your oral, cervical, and breast screening. So oral has basically 4 steps. Okay. So you will have symptoms, examination, and the referral. So there is no issues in the mouth. If there is an issue, you have to say yes, the other field gets activated. Okay. During your training, you must have been trained about the identification of red and white patches. You have to do your examination and come out with that particular thing. If there is no case, go to the next level. Okay. Date is mandatory. If you forego any step without filling it, system will prompt. So it's made in that user friendliness so that you can do it. Visual examination, you identify white patches, this icon gets activated. You have to identify which place you have seen this. What happens is that it becomes easy for the next level officer, be it medical officer, to identify, okay, in this particular place, this issue is there, right? Or if a new issue has come up, that can also be viewed after a certain point in time. So there are options to take certain picks also. If not, the last step comes, which is it gives you a screening summary, whether you have to refer the patient or not. Since you have identified the white patch here, so you have to refer the patient to the next level. So this is how you do the screening for the oral. Okay. Similarly, you have for breast screening. Again, it is a 2-3 steps thing. You have symptoms, examination, referral on the top. Any breast related symptoms, yes and no, and ask these questions. If it's no, you can go to the next step. Okay. If it's yes, you have to fill. I mean, it's all radio button. You need not type any, there is no typing business here. Only in the remarks you have to say. Here also you have a diagram. And if there is any of the symptoms you identify, there may be a case that patient will say, I don't want to get screened by you. Okay, go ahead and then say that patient has a refuse screening, but you have to train them on SBA, self-breast examination, the training which is being given to you. So you have to do yes or no. Okay, do yes or no and go to the next level. No referral, save it. Since there is no case suspected, so you said no. So you see the status here, it becomes no visible symptom. Right. Similarly for the cervical screening. So first thing it will ask, have you been trained for VIA or not? It's a separate set of training given. If you say yes, then the examination section gets opened up in the app. If you say no, only you will have to do the symptom section, yes or no, the questions what you see here. Go to the next section, which will be referral. Okay, so your VIA and step 2 and 3, you see on the top, your examination in VIA get disabled. So you can't do anything here. Automatically, the patient gets referred as per the guideline. Okay, so this is how you have to fill your app. Okay, if a patient is in front of you, depending upon your skill set and the speed what you have developed, initially I agree it will, because you have to set your hands on the system, it may take a couple of minutes more, but as you keep screening again and again, things will be on your tips actually, right? So this is how you do the screening, and on the top you can see the summary for this person, for which all diseases you have done the screening, and you can see what are the readings and all in one go. You can see in this summary. The last one is general. General is a very important thing. General is basically your OPD section, whichever individual. So the scenario where you have 100% population enrolled, and you have to capture your OPD screens. So you can just open your mobile, just click on general disease, okay, and see what is the date, enter what is the problems, the complaints the person is coming up with. And here also no typing business. I mean, typing in the sense you have to write the nature of the complaint. Let's say body pain. The moment you write body, BO, you will get the options. So options will get pre-populated. Let's say fever. So fever will get snake bite or whatever. Okay, snake bite is there. Okay, so all those things you can see here. Okay, and if you are giving medication for this particular thing, you cannot always click on the add medicine. What medicines you are giving. So it's as per the EDL, whatever medications or medicines are available at your level, you can select any of them and then give to the patient. I am just randomly selecting anything now for the sake of demo. And then you can prescribe the duration here, 1 day or 2 day, whatever, before food or after food instructions, once in a day, twice in a day. And you can set a follow-up date, आप मेरे से 10 दिन बाद मिलने आइए to show me the thing. So when you set that, it comes in your work plan, that you have to save this question. So this is how you do the normal OPD screening also. So that person's detail gets captured here. And you can see the history. So when the person comes to the next time for your screening, the best part is that you can quickly click on the journal and you can see, okay, for so and so date, this person has come and this was a complaint with which it has come and this is the medication I have given. So it gives you the history also, so for you to go through it, understand what is the background of that person. So maybe 6 months or 1 year or 2 year down the line, it helps you for decision making, right? So that is what is all about your screening business. So any doubt here? So this is how you need to do the screening. This is scenario one where enrollment was done, you pulled the record and you did the screening, right? Now after the screening, you want to see ki, how many screening I have done, मेरा परफॉर्मेंस क्या है, मुझे कैसे पता चलेगा? तो आप ये जो टॉप में जो 3 बटन्स हैं आपके जो द मेन्यू बटन विच आई वाज मेंशनिंग, क्लिक ऑन द डैशबोर्ड. आप डैशबोर्ड में क्लिक कीजिए, यू विल गेट ऑल द डिटेल्स कि आपके जुरिस्डिक्शन में, आपके जो SWC में या सब सेंटर्स में मेरे ये टारगेट थे, मैंने कितने एनरोल किए, उसमें से कितने 30+ थे, मैंने कितनों का पूरा ट्रेनिंग स्क्रीनिंग किया है फॉर ऑल द 5 डिजीजेस इन केस ऑफ फीमेल is defined as all diseases screening, or if it's only 3 in case of male, so breast and cervical doesn't come. कितनों का rescreening किया है, how many cases I have referred. Referred has 3 elements. Early detection is from your CBAC. CBAC is a early detection section. वहां से कितने referred होके आए हैं वो केसेस, आपने कितने PHC को भेजा है और हायर फैसिलिटी को, कितने अंडर ट्रीटमेंट है, and what follow-up needs to be completed. So in one nutshell, as a CHO, I will be able to see my performance, I will be able to see my track record ki kya ho raha hai, right? So this dashboard is very important. Now in this, now I want to see कि मैंने कितनों का partial screening किया है. So the numbers what you see on the screen, except for the target number, you can click on any of this number, you will see the line listing of the patient then and there itself in your screen. So I want to see कितने लोगों का partial screening किया है. मैंने I clicked on number 4. So these are the 4 patients, for which I have done the partial screening, right? So that is what I can see in the on the right side. I can see it's partially screened. I want to see how many of them are under treatment. Click on this number 10 there. So this is a list of the patients which I can see which is an under treatment. Okay. So this is the list of the patients I can see they are under treatment. So what I need to do is click on the name. I'll land on that particular person's page, and hypertension, let's say this person is under treatment. For some reason, I'm not able to click it. Anyway, so what I just land on that particular page, and you have to add on the follow-ups there. Okay, so that is how you do the follow-up of that person. Okay, and you view your dashboard and your performance.
And Sunish, you can click on that enrolled list once, let's say enrolled 30 plus 191, and we can show that it also shows a message that the person is screened or not screened. So that becomes clear that this is the list of people who are not screened, and we can access those records easily.
Yeah, so on the right side, you see there is not screened. If you have taken the pic of that individual, you see this person named Sridhar Lakshman, this name. So you see, I mean, this was taken in some training. That's why you see some pics there. If you have taken the pic, you are NM level or at, Asha level, so you can see those pic also. So that is how. So all the 191 will be listed on the down. On the down, you have to do just the next. You see the next button here. So first you have to click on the next and go back there, right? So this is how you see the dashboard and access the dashboard. Okay. Now subcenter profile, I have already informed you. Language, again, it's the same setup. I'm not repeating the same thing. So these are the key things what you see on the segment, right?
Sunish, we can also show a case of follow-up. You just pick a patient who's on treatment and we will add a follow-up.
Yeah.
Yeah, let's say for hypertension, he's referred. You picked up
First, that need to be diagnosed at MOF, then only.
Somebody who's on treatment. Just go to dashboard, on treatment, under treatment 10. That list we will access.
Yeah. So there only I'm clicking. So let's say
Rakesh.
This under treatment. Okay. So the under treatment. Okay. So this is how I'll repeat it again. So let's say you go on the under treatment case, the 10, okay? You want to do the follow-up now, right? You go down and select this person for whom you want to do the follow-up. Click on the name, that person's screen lands there, okay? So you see in hypertension, it's mentioned under treatment. I click on the person. So this follow-up screen comes. On what date? Date gets captured here. And what was the reading earlier, it comes and shows here. You just click on the add follow-up button on the bottom, click on the add follow-up, and let's say I did the follow-up today. So today's date come, and what was the reading? Has it come down on that particular day? Whatever the reading comes, you just put it, okay? And RBS also, if you want to put, you put some number, okay? And then height and weight, it gets captured. Advised, so have you advised the patient to again go back to MO? No. Lifestyle modification, you have to check whether if the person is alcoholic or smoking or dietary pattern or regular exercise, yes or no. You know, you have to do that and then save it. So the record gets saved. This is how you need to do the follow-up. So easiest way is go to the dashboard and click on the under treatment case, and then see you will land on this disease screen and then click on the follow-up part. So this is how you do the follow-up also. Okay.
Yeah, and just want to add one more time about the list of people who are not screened. So in future, we are planning to give all those activities differently, like screened and not screened. But as Sunish showed, currently, you can access the list of people, let's say enrolled 191 count, which Sunish is showing. If you can click again, Sunish, on that list. The list is sorted on based of screened and not screened. So आपके not screened individual पहले आएंगे. It is sorted as per that, or screen बाद में आएंगे. So you can easily use it for the time being till in future we come up with a better solution of having separated them, right? So it is still accessible.
Yeah. And one more thing, there is an important thing which is called work plan, which is there in detail in your dashboard, in your tablet version. We will soon enable that also. So work plan, as I explained in the Asha segment, control case, uncontrolled case, you know, those kind of things you can easily pull up here. So in your tablet version, you will have a detailed thing there. In the mobile version, we will be putting it up soon actually. Okay. So this is the scenario where the patient is enrolled and you have to fetch the record and then do the screening. Okay. So this is scenario 1. Now I'll go to the scenario 2, where you have the family folder and CBAC, and you have to enter the details. So what you do is that click on this add new family. Okay. So when you click on this add new family, again the same step, what you have seen in Asha, the head of the family, the type of house, everything is same. It's a multiple select choice. Okay. All those things you need to fill and then enter it. Maybe I can give you quick one small enrollment. So just head of the family you fill. I'm not filling other fields for the sake of time. Village is mandatory, so I'll fill village. I'll select which village the person has come up. The person's name again. Okay. Whatever mandatory field. Okay. Go down, save it. Okay. The enrollment is saved. So this is how you do the save enrollment. Then CBAC has started. So in this scenario, you will see the CBAC forms not being filled. Now the same story will come what I have shown you in the Asha. So CBAC form, new one, old one, click on the section, do yes, no, yes, no, yes, no, quickly fill it. So this way you can do the CBAC section at your length. And if you want to add the more family members in that, go to the family button on the top, click on the add members, and you can keep adding more family members to that particular family. So that's how you do the family. The definition of enrollment here is your family folder, and 30 plus is obviously your CBAC. Okay, so you have to ensure that whenever if the family folder is not there, you have to please fill the detail. And then the same process starts of screening and, you know, dashboard and the follow-up and the sync and all those things will come. Okay. So this is how, and now you see the sync is in progress. I've been using this application for some time. So the auto syncs feature starts working here. And depending upon my internet speed, the sync gets completed, right? If not, then I can click on the top button here and then sync will, the process is starting in the backend and it will be done. Yeah. Okay. So this is all about your CHO and A&M app. Any doubts, any confusion, or any questions being asked in the chat box? Prashant, you want to highlight any critical
Sir,
question?
there are many questions. I'll start.
Sunish, we will touch upon the rescreen once till Prashant comes up with a list of questions. एक बार rescreen दिखा देंगे. At least we will show them the option, even if it's not enabled.
Okay.
Let's pick some individual who is already on treatment में से उठाते हैं.
Let's say the
Let's pick someone from dashboard.
ऑलरेडी ऑन ट्रीटमेंट तो फॉलो अप पे रहेगा पिंकी, रीस्क्रीनिंग क्यों होगी?
हाँ मतलब सॉरी या जो ट्रीटमेंट पे नहीं है.
But then we have to see whether that person has completed 1 year, no?
हाँ लेकिन at least that option will come. It will be disabled. Let's show them that option.
Okay, so these are the list of patients in your under treatment. Let's say I click on Sunita.
Referred जो है ना, let's take that individual who's referred. Come, yeah, referred for diabetes, right? Click on that. The rescreen option is there. Plus, referred, diabetes screening.
Yeah, but the thing is, this button is not working for this patient.
So okay.
Take some other patient. Let's say Seema. The plus button in this mobile is not working.
Okay, let's click on hypertension. Just click on hypertension. Just click on hypertension for same patient.
Yeah, I'm clicking, but that's not getting into it, huh?
अगर 1 year से कम में डेटा भरा है तो नहीं होगा.
No, but at least that rescreen option will be disabled. We can show that where to access that once the person
Okay,
is
right now it's not getting clicked. What we can do is that we can always get back with the other ID which you have.
I think some network glitch.
Yeah, this is already there. So rescreen option, what you see, click on it, the I button here.
Yeah. So because basically this individual is not eligible for rescreen. So what we wanted to highlight is for the people who are not on treatment for any of the NCDs after a year for diabetes and hypertension and after 5 years for cancer, this rescreen button will get enabled and you can click on this button and a fresh page will render in the application wherein you can again take the readings and do the screening. So that is what we wanted to highlight, that for eligible people, this option will get enabled, rescreen.
Yeah, so you see when I click on the rescreen here, you see the message which is popping up here, not eligible for rescreening as per the current disease status. So as per the guideline, for hypertension diabetes, you have to complete 1 year from the date of today's screening. So I have screened this individual today, 10th, not today, yesterday. So this person will be eligible for screening for the next year. It will automatically come because system will detect it, right, Pinky?
Yeah. So this particular patient, since he's already on treatment, right? So he's no more eligible for rescreening. That's what the message says. For any other individual, right? Let's say he's referred and he doesn't reaches to the facility. He's not examined by the doctor and he just remains in the referred state, let's say. So after a year, A&M CHOs, they can come back to the patient and do the rescreening. So that is how it works.
Okay.
And Sunish will also show the delete function.
Okay.
So maybe you can enroll an individual with the same details, right? Let's say that Bindya, you enroll another individual Bindya, and that's a duplicate individual, and we'll show how to delete.
So now you see on the screen, people were asking if I want to see by mistake, I have enrolled 2 Ramus. Okay, so you see when you type in the search, you will come up with 2 cases in the name of Ramu, and you have to delete 1. So you will see this Ramu bottom as a small checkbox on the right side. Now I clicked it now, it has turned blue, right? See, I'm again clicking it, it has turned blue now. So this person is a wrong entry, duplicate entry. I want to delete it. Okay, by mistake, I have put the age, whatever, 70 or whatever. I go and delete that person from here. and the person's record gets deleted. Before that, I have to put the login has two-step authentication. I do that. This person gets deleted from my screen. If you have referred, अगर आपने किसी पेशेंट को रेफर कर दिया तो आप उसको डिलीट नहीं कर सकते हो अपने मतलब रिकॉर्ड से. So you
हाँ,
have to
मतलब
be
वो
very
रेफर्ड
careful.
पेशेंट अगर डॉक्टर ने देख लिया ना, उस पेशेंट से मिल लिया, उसको एग्जामिन कर लिया, तो आप डिलीट नहीं कर पाओगे. सो टिल द पॉइंट एट any doctor, nurse, anybody accesses that records and updates it, then it is not possible to delete. Otherwise, अगर आपने अपने लेवल पे by mistake duplicate entry हो गई है, तो you can still use these option to delete them.
Okay. So enrollment level पे आपको पता चल जाता by mistake मैंने दो नाम प्रेस कर दिया है. You may encounter this scenarios, right? Touch screen is not working or whatever, and whatever possible reasons, just click on it and then you can search the patient. आप ऐसे patient records को search करके आप उसको अपने record से हटा सकते हैं. Okay. Anything else in this?
Now we can take the questions.
So you come up with the top 3-4 questions and
Yes.
already
So
one
one
of
major question again and again being asked is, in case of death of any person, how to select that particular option in the follow-up section? So the further follow-up for that individual would not be required.
Pinky, would you like to address that?
Yeah. So currently we have option of marking death only. This option has been given to the MOs as part of their work plans, right? Wherein they can take action for the people who are not coming back for their visits. उसमें हमारे पास ये option है MOs के पास कि वो expired हो गया है, patient mark कर सकता है. But at lower level, we have currently not given that option. It is planned for future. So if there is a high demand, definitely we'll take this into consideration for future releases for the healthcare workers. We'll show you this option in the MO work plan once we go through.
The question continuously being asked is, if person goes to higher facility post referral and not come to CHO, so how they will fill it? So they would be able to search the individual.
Yeah.
So fill what? Sorry, Prashant.
If one person post referral do not come again and goes to higher facility directly, so how their forms will be filled? Means
So
one person has been referred and he directly visit either CHC or DH. So how their forms will be, information will be filled?
So which information? I mean,
for a screening thing majorly.
Yeah, so basically once action at higher facility, if the screening is already done, later also the NMCHO can fill that information. So although the patient has been seen at higher facility and let's say the patient is found to be NAD, लेकिन अगर screening करी हुई है, NMCHOs can later on like fill that information through the app. It is possible. They can search the patient, go to that record. The patient is already marked NAD, but at least screening का data enter कर सकते हैं. That is possible.
One question is how to download the line list report downloading. So right now we have in our dashboards cumulative numbers at the each facility level, like CHOs and Ashas can have the line list for their field area, but at district level complete line list is not possible, but if required that can be fetched from data center and can be given.
Yes, that is right.
Delete village options they have continuously asked. So how to delete the villages for remapping and those things? So this
delete. Yeah. Go ahead.
Please continue, Sunish.
No, delete of villages and all will not be possible at your level. So you have to give the request to your respective district and the state. This has to be done at the backend level.
Yeah, one question was, if they update the application, whether their old data will be coming in the new version? Yes, it would be possible. If the data in the old version have been synced, it will appear in the newer version also.
Yes. So you have to regularly sync the data So all your by default it works like Facebook and WhatsApp. So when any new version comes in Facebook and WhatsApp, your old data doesn't get deleted, right? It's the same way, the same function it works here actually. So no need to worry about it, but you have to sync the data. That's the thumb rule. Next.
One question is, if one family has a elder son and he get married and he make other family, okay, so how the family can be divided? So at present we do not have this feature available to remove one person from a family and create a whole new family for them, but yes, it can be added as per the requirement.
Very interesting question, but right now the option is not there. We'll think about it actually. Yeah.
So another question is whether CHO app is available in iOS version, Pinky?
iOS, to my
Not
knowledge, no.
currently. No.
Not currently.
It's only Android right now.
Yeah, one question has been asked regularly whether with the help one ID can be logged in different devices for Asha and CHOs. So these Asha CHO apps are offline apps. What they do is they get stuck with the one particular device. If user changes the device or they want to use their ID in some other device, first they need to detach that ID and device with the help of district admin portal. So district NCD authority would be able to help you in that. The device need to be delinked from the ID, and post that you can do that.
And this particular issue is purely from your security perspective, because it's a line listing of data. So with line listing of data comes certain set of security guidelines which we need to adhere to, and that's the reason why we have to detach the old device ID and then from the backend from the admin portal, and then take the new one. Okay.
One question is, there are females with hysterectomy history who do not have uterus. So why it is showing forcing even to do VIA for them also? Otherwise, it is showing in their pending list.
Okay, we'll take it up. Good question. We'll record this question and we'll take it up for further discussion, and then we'll come out with the solution.
So if required for Ashas, can the total population, target population can be changed or not? So yes, they can change it with the help of MO medical officer or with the help of district admin. One question is, do they need to fill CBAC every year? So yes, CBAC need to be filled every year.
Yeah.
CBAC has to be filled every year. That is what guidelines suggest. And basically what happens is when you do the enrollment for the first time, all your record gets saved there. When you're doing for the next time, you can only that particular section or particular fields which needs to be updated, you can update it. Right, Pinky?
Why in your screen all the forms were filled by one Asha only? So here they have enrolled in the testing version one Asha only, but accordingly in your area, if you map more than one Asha, two Ashas, three Ashas, accordingly you would be able to see their performance. So don't worry about that. One question was, do we have one app only for Asha and CHOs, or do we have separate apps? So there is one app with different IDs. They would be able to see actions according to their cadre.
Yes.
And another one request is there, Pinky, if they can get filters in the search option. So accordingly, they could fill from the limited denominators.
Okay.
What filter? Okay, maybe we can.
Village filter or something. Yeah.
Yeah, like for example, screening filter, particular disease-wise screen filters they want.
Okay. Yeah. Okay.
Yes. So these were the major questions. I hope I have covered everything.
In fact, that screen, if it's that work plan gets enabled, so they can actually from the village profile they can do it. Okay, when it gets enabled, we can touch upon it.
Yeah.
Okay.
Yeah. Sunish, maybe if we want to show the screenshot of dashboard or work plan from tablet, just to cover it, the larger audience.
I have this. Screenshots.
Just change the orientation slash.
Do you have any PPT with the screenshots?
Yeah, I have.
Can you pull it?
Shall I share?
Yeah. Do the sharing. I need to unshare it here.
It should work. You have to unshare.
Yeah, I can see a screen. Okay,
So we
quickly.
just,
Yeah.
So we just wanted to say that this is the complete dashboard. Okay, so we have given the CPHC HWC app now in mobile. It is already available in tablets, and for the tablet users, this is how the dashboard looks. So you have the cumulative numbers as we were showing in the mobile also at the subcenter level, plus disease wise you can see all the indicators, and there are a bunch of filters available. Like you can, somebody was asking if we can find out how many screening done in a month, so you can easily find out by applying a filter over here. You can also filter by village. So these options are kind of available in the tablet and will be brought up very soon in the mobile view also. So this is one point what we wanted to call out. And secondly, this one, right, something like this, the work plan is also available in the tablet for ANM CHOs to use, wherein you can look at the different list by priority follow-up, the people who are uncontrolled for diabetes or hypertension already on treatment. So that list is available separately. The list of individuals who are supposed to get screened is also available separately. So that could be leveraged. This functionality also we will bring up in the mobile version very soon. So just wanted to call out. Thanks.
Okay. Thank you. We can close this CHO ANM session now, and we will move to this place, next one. Okay. Yeah, I have to share the screen, right?
Yeah.
Wait. Can you? Yeah, you can see my screen. So now the next level is mobile application for MO. Okay, so mobile application for so MO can be accessed. The medical officer at PHC or CHC, they can access the portal either in their mobile and even in the laptop. So in mobile it works. I mean, they need not download any app. Okay, so they have to click on the Chrome button. Maybe I will show that to you. I'll just, okay, I'll close it and show. So this is the Chrome button. I go there and click on the my portal address. So the username comes. They have to put their password. They can store their password if they want. Put the captcha and enter it. So you see, it's called PWA, Progressive Web Application. It's not an app which they need to download from Play Store and all. For this, you need to be connected to internet. So internet is mandatory in this particular activity. So you can log into the screen. This is how your homepage looks like. So homepage will have the critical 4 elements. What will MO do? What is the first thing what an MO do? MO will search or fetch the records, number one. That is why you see the search there. MO has to review the performance of the subcenters or the CHOs under their jurisdiction. So they can click on the dashboard and see the data. Work plan is also an important tool for MO to do the review and monitoring and supervision, and also to see what are the pending actions at their level. And new enrollment. If suppose a scenario where it is not enrolled by Asha or ANM or CHO and the patient directly reaches there, so the MO can do the fresh enrollment also. So again, there's two scenario I will show here. One, when they do the new enrollment. Second, when they have to fetch the record which has been referred by the people from CHO and ANM level, right? So what I will do in this scenario is that I will go and click on the search button. Okay, in the search button, I have this option to search the individual by their name, mobile number, the health ID or the government ID, whichever I have enrolled. Okay, and take one or two name indicators and try to search it. So on the top, you see, within district and all district, so this option, all districts means, within district means, let's say I am sitting in a district called Raichur, and I want to see the cases within the Raichur from other PHCs also. I can click on it and I'll get all the list here. All districts within the state, whichever district is there, I'll be able to pull the records within the state. So interstate is not activated now. So in this scenario, what I'll do is that I will fetch records of Mala. I mean, the person who was enrolled by Asha, screened by CHO. Now it has been referred to MO level. So MO puts the name, searches the name pushes up. All the name with the name of Mala will come and pop up in your screen. So I have to select this person called Mala. So I click on this name, which is the first record here. I will land on the person's disease screen. Now this is where MO has to do their examination. On the top, you see it's the summary field, which the summary what ANM or MO has, ANM and CHO has done in their records can be seen here or viewed here, right? There is no history, no medication. Has there been any medication history? Like this is a follow-up patient, you would have seen the this thing also, medication history also, right? Now in the assessment, they have to do for the 5 disease. Okay, so hypertension, this 4-5 disease, what you see here, and you see the action it's given referred by sub-health center. It has been referred from the center below, right? So what now MO has to do? Click on this hypertension link. Okay, so your hypertension page open. Hypertension, any disease page for MO will have 3 features. As you see in the top, examination, diagnosis, and treatment. Okay, so these are the key features. First, he will examine, put the diagnose the patient and put the person on treatment by issuing medication, right? Then the date is mandatory by default, it populates. Then they can further refer the patient from here. If there is a follow-up action needs to be set in, they can do the action here. Treatment history, if there is any treatment as a follow-up patient, they can always say, since it's a fresh patient, I cannot see any history here. Investigation, I have to add any investigation, lab investigation, I can add into that, right? Then comes your BP readings and the brief examination, what MO has to do. BP reading is mandatory. Just put the reading here. Whatever you put the pulse rate. Brief examination, again it's a radioactive mode. Whatever, yes, okay, and save and continue. Then they will go to the next page, which is your examination diagnosis page, right? Now you will see this kind of messages which pops up, since it's a special case. So a lot of decision support system is built in the backend, which will prompt the medical officer before initiating any kind of treatment. So in the diagnosis page, as per the guidelines, the recommended action will come. It will say it's an uncontrolled patient. So the doctor has an option to refer the patient in case he or she feels that, right? If not, they can always go ahead and then start the treatment. If they have to override the recommended action, doctor says, no, I want to override the recommended action, or he feels that it's okay. Maybe after 10 days, I'll again check the BP reading. So it might be normal. So for the time being, he or she leaves it. So they can do NAD. Okay. If they want to put on stage 1 and stage 2, click on that button there. It will turn purple. So then the action can get started. So I will say stage 1, save it. You want to confirm? Yes. Go to the last page, which is your treatment. Treatment is basically what you have to do. You have to give counseling to the patient on a diet. Usually what the doctor does when you go, okay, avoid salt or avoid consuming alcohol or tobacco, start walking, do a little bit exercise. A lot of suggestions or lifestyle modification basically is suggested by the medical officer. So once their counseling is done, they have to just press this button to activate it. It's a mandatory field. Okay, if you don't fill that, you can you will not go to the next step. Then comes the medication advice. Whatever medication advice you see is as per the treatment guidelines. the national protocols. That's why it's showing suggested treatment. If MO says that I want to take a alternate treatment plan, they can always click on the alternate treatment plan. This page opens up where they can choose the medicine by clicking on the medicine, any of the medicine which is listed in the EDL. So let's say they will type whatever name. So all those things will pop up. I'm just taking some random drugs name. So whatever duration they have to set, okay, before food, after food, save it, and they can give the reason for choosing the customized plan also, whatever they want to give, or they don't want to contraindication or whatever. Review the follow-up. If you see, by default it's 3 months. Guideline says 3 months. They can always reduce it. They say that come after 3 weeks. So this 3 weeks gets changed, your date gets also changed, right? And then you go and finish it off. Okay, so this is the way MO has to do the treatment. So this becomes the definition. Now it becomes under treatment. So treatment history can be seen like this: which medication was given, what was the review, okay, and then you close it. So the hypertension on treatment has started at PHC. Now, since it's an online, the moment ANM and the CHO and the ANM and the Asha syncs their tablet, the record from here will flow down to their tablet or the mobile in their work plan. Okay, if this person is under treatment, now you have to follow up. Okay, as a controlled or uncontrolled patients, what we have seen there, right? So in the similar way, they have to do treatment for other 5 diseases. Diabetes is also in 3-step. I mean, examination diagnosis. They have to put the sugar level. Okay, do the brief examination, go to the next stage, and put the person on treatment if required. Okay. Now, the cervical screening is a referred case. So you see the cancer part. I'll open one cancer screen here. So cervical screening will have the VIA testing to be done at that level. They can say positive, negative, whatever. Negative they choose. If it's positive, they can choose on the positive part. If it's a suspicious case, they can click on the suspicious part. Okay. And then they can go down for the inspection, whatever the inspection as per the treatment protocol they have to do. They have to just fill this with yes or no. It's again a radio button. They can do yes or no, and then they can go to the next page. Saving all the details, can go to the next page, right? So at times you will also encounter this kind of issue. What you see on the screen, application is not working, but don't worry, you can always do it in the, you can always press on it and then address this issue. Similarly, you have oral and the breast cancer, the same step, same thought process: examination, diagnosis, follow-up, and all in the top. You have to just select any of this field by saying yes and no, and then move on to the next step. Any clinical breast examination indicates no abnormality detected, no referral required. Doctor, if have to give the if doctor has to give the whatever any observation, they can always write in their observation side and then go and save it. So this is how you save the detail. Okay, so this is how the doctor has to do in the using the mobile. It's very simple, very user friendly. As and when they start using it, it becomes more and more easy for them. So this is how the MO application is being used by the MO. So this is one thing about the screening part. The second thing is that when the person comes directly, okay, there is no enrollment done, go to new enrollment, click on the new enrollment, and select the district, whichever district they belong to. In my case, I have selected, already been selected Bangalore. Select whatever sub-center or village the person comes from. The first name you just write, whatever male, female, gender, mandatory field you fill it. Okay. And then mobile is suggested to be filled as mandatory thing. ID, if it's there, capture it, submit it. So your enrollment gets saved. Date is mandatory. Without a date, you can't move in. So you land on the screening page. Once you land on the screening page, the process remains the same. What I showed in the earlier step, hypertension, diabetes, go into the disease screen. So this is how you do the screening for a fresh patient or a patient who has not been enrolled, right? So this is about the screening part. Search the patient and screen. Now, there were questions I have seen in the chat asking about the health ID. Health ID is an important one. Let's say in the person whom we enrolled, Mala, I go and search the person's name here, and I see that person health ID is not created. I'll click on the health ID here. The next page which comes and it shows health ID available, yes or no. If it's available, press on yes. Okay, whatever the health ID is generated, go and click on the link health ID. You will have this page popping up. Put this ID and link it. Okay, so that's how the linking can happen. If the health ID is not made and the person health ID has to be made, what we need to do now is that just click on the health ID here. Sorry. Health ID. Sorry, what I'm trying to do is that click on health ID, but the entire name gets clicked. Just click on the health ID part only. So the health ID opens. No, create generate health ID. One page will pop up where you have to enter the name and the Aadhaar number. The moment you enter the Aadhaar number, you have to give the consent, put the consent, submit it. In the next step, you will get an OTP. Fill that OTP and then save it. So once you fill that OTP, your Aadhaar ID, health ID will get generated. So this is the step you have to create the health IDs. Pinky, Prashant, do you have any other ID where we can put it and try to create one if you have? Otherwise, I haven't kept my other ID here. Pinky or Prashant, can you hear me?
Don't have it handy. We have to
No
create
problem.
a profile.
No problem. No problem. So this is the step. I am again reiterating the step for all of you. Health ID available? Yes, no. Click on no. Generate health ID. One page will pop up with all your names and all. Put your Aadhaar ID there as you see in the screen. Take the consent. Click on submit. One more page pop-up will open like this. OTP will come. Enter the OTP. And then save it. So your health ID gets created. So you can print the health ID and give it to that individual also if you have a printer in your subcenter, in your PHC, right? So this is the way you create the health ID. So this is all about your ID business. Now, the third important aspect for MO is to see the performance, to see how it is functioning. He can click on his dashboard. He or she can click on the dashboard, see the parameters here, enrolled or whatever, all the parameters of examined, on treatment, diagnosed, referred by subcenter. If you want to see the subcenter wise indicators, he can click on this. All the subcenter listed under him will come up here, so since it's we have only one subcenter listed here, so I am seeing one. In ideal case scenario, it could be 2 or 3 here, or 5 also there, right? So I can see the enrolled, examined. I just scroll across here, diagnose, on treatment, subcenter wise I can see, right? I click on the subcenter wise name. I can see the village wise also. In each village, let's say 256 enrolled hua hai, so which are those villages jahan se enrolled hua hai? So I can see in these 3 villages it has been enrolled, right? And village 3 is 0. So what will I do as a medical officer when my ANMs or Ashas or CHOs come for a weekly or fortnightly meeting in PHC? I will question them, what is the problem? Why you are not able to do that? I'll try to solve the problem. If I'm not able to do that, I will get in touch with the respective district officials and try to sort it out. Or ask the other ANMs or the Ashas to help that person to solve the issue. Can be anything. The MOs has to be smart enough to take a decision based on whatever situation they're in. So they can see all the indicators subcenter wise there, okay? And they can click on this name. So the drop down will come. So this is how the dashboard can be seen. They can click on the work plan. Right now, I don't have a priority follow-up referrals. So I click on the whatever referrals I want to see. There is no referral in this PHC.
You referred some individuals, right? Right
Yeah.
now?
So there are, see, on the top, you see the button which I'm clicking, right? So basically, you can see the priority follow-up, the referrals here. Not sure why you don't have any cases here. Let me take the year a little bit more.
Yeah, look for a year's time. No, it has to be 1 year, 21 to 22. Can I try? So something like June 21 to current.
Yeah.
Okay.
So now I went to a little bit old. I mean, I just selected the date earlier. So if you see on the top, okay, you have a priority follow-up list. These are the people who are uncontrolled case and they want to, be tracked soon. Second is your the referral. Sorry, again it has gone back. Anyway, I'll come to that. Third is your incomplete records. How many records are incomplete? Incomplete, the definition is A&M has done one screening or two screening, or there are some fields she has not filled in. Those kind of records can be seen. They can see the subcenter wise summary. In that subcenter one, how many users are being registered. Now there are a lot of users here. In ideal case scenario, you will not have so many users. Okay, you will have your ANMs or CHOs or this thing. And what are the approvals MO has to give if somebody does any modifications there in the village population part, they can see here. Okay, so I'll just go back and again select the duration here for making things easy. One minute, just I select. Okay. Yeah. So priority follow-up I can see here. Okay, there are 9 people whose priority needs to be followed. You can see controlled or uncontrolled cases here. Okay, so what are the action now? Once I see, so uske baad mujhe karna kya hai? Click on the action here. Okay, so action mein I need to take, action as I have defined earlier. The person is seeking private care on patient has expired. Somebody was asking a lot of question. What about the patient if it gets expired? So you can update from here. Not responding or patient is not willing or migrated to other place. So any of the action they can take and then close it here. Okay. So once I close it here, it moves out of the record from here. Any reason why this is happening? Again, I have to select.
Okay, the
No issue?
filter is getting removed, is it?
Yeah.
Okay,
So,
okay. We'll check on that, Sunesh.
yeah. So the filter, these are the referral and buttons. So when you click on the referral, you can see the users which are below you under the PHC. Where are these patients referred to? Amit has been referred to CHC by PHC. Lakshmi has been referred by health center, sub health center for hypertension. Okay, so the referred to CHC is by the PHC. That means MO has referred that particular individual, right? So this is the way MO has to view the work plan. Okay, so and that way you can do the other sections also. Even in incomplete record, you can fetch the records which has been not properly filled, or there are sections which need to be filled by the ANM or the CHO. That can also be seen from there. Okay, so these are the you see the action here. Diabetes examination is pending. She must have filled it and not done the examination. Okay. Paul, in Paul case, diagnosis pending. So diagnosis has to be done. Okay. In this case, both for Rakesh's case, both hypertension oral diagnosis is pending by at MO level. So all those things can be seen for the MO. So it becomes a very important tool for a medical officer. At the primary level, if I have to improve the efficiency, one of the best tool is your work plan and the dashboard. Open it, discuss with your the group or the gang of your CHOs or ANMs and the Ashas, and come out with an efficiency. This is the way you do the MO app. The similar one you have for a portal one. Portal one is a little bit on the same thing is there, but you may have, there are more other fields. The fields of pharmacy related and all those things are there. I'm not getting into that. But in the portal, there could be a scenario where Ashas have done the hard copies or of family folder and CBAC, but you don't have time to fill it. So you may have a data entry operator, give it to them. So they can go to the portal and they can fill it actually from that portal. So to reduce the workload for the other thing. So many things can be done from the portal, and these are the key things which we have shared. So anything else you want to add, Pinky or Prashant here?
Sunisha, I've just sent you one Aadhaar information. Just see if we can show it. What's up?
You wanted to show the card, Aadhaar card?
No, show it, the linking in our application. Enroll that individual.
Okay, this is the Aadhaar number, right? Can you just remember the number? I'm just using the. Wait, I'll do one thing.
I'll call out the number.
Wait, I'll do one
You have
thing.
to enroll the individual, right, with the same name first.
Yeah, wait. I'll do one thing. Instead of using the app, I will use the portal version. Okay. So in that way, we can see the portal version also.
I'm
Okay, now
messaging you the name and all, so that will be easy for you.
Yeah, this is the same ID which this is the same ID which I showed you in the whatever on the mobile. So you can see the web version on it. So it's a bigger version. You can see the NCD enrollment. Enrollment has CBAC, family folder and CBAC in detail. And if you want to do a screening also, ANMs or CHO screening to be entered in bulk, you can do with the help of data entry operator here. And you can see the drug stocks here. I mean, these are the detailed one. I will not get into all those things. So I'll just go to the enrollment, take up the enrollment part, okay, and do a quick enrollment. Okay, so save and continue. Choose a date. Okay. Did I put any name there?
No, you have to add a name. I have pinged in WhatsApp. Use the same.
Okay. So I'm just putting the mandatory fields here. I'll save and continue. Okay. So I'll skip CBAC. I mean, as an MO, I can always skip CBAC. Okay. I will get the person's thing. Now this is a person's. Okay. So before, wait, I'll search the patient again.
Yeah, you have to search him.
Yeah. So once after enrolling, once I search, you see the health ID here. Click on the health ID. Okay. So the health ID page comes in portal like this. You want to generate? Yes. Oops, sorry. You have to create yes. And it has to go save and continue, right?
Health ID available? No, right? We will create one.
Sorry.
You just go back, search. So you have to search the patient, search the individual basically, click on the health ID option. And we are saying that we want to generate a health ID for this individual. All right.
Yeah.
I'll
So I hereby confirm it, submit it, and this will go to the next. So Aadhaar ID comes, sorry, the OTP comes to the registered mobile number.
I'll get
So-
1 minute.
So the moment it comes, we will put that number. You got the OTP?
559849.
55984, right?
Hmm.
So now what will it do is that system will check with the Aadhaar details. So in Aadhaar, these are the full name, okay? The last name, the exact date of birth, the exact address. So in the NCD system, I have put only these things. So I will do one thing, I'll accept and link health ID, and my health ID gets created. So this is your health ID which gets created. So you see the health ID here, 37544, whatever. Now you can also print it. If your printer, laptop or system is connected to a printer in your PHC, print it and give that record to that health ID to that individual. So this is the way you have to create the health IDs. It's a very simple step actually. You have to just follow 2-3 steps. Yes, no health ID, generate health ID, put your Aadhaar number. The mismatch details will come. You accept it. Your health ID it gets created. So as simple as this. Okay.
Yeah,
Any
and the benefit of this is your NCD data gets so much enriched. You get the actual mobile number linked to that person. You get the complete credentials, address. So the NCD data quality improves also in all
Yeah, and
like in the process
also
of creation of this health ID.
correct. The best help health ID can give you is that instead of searching it through the name or mobile number, I can use the health ID, last 4 or 6 digit ID, and fetch that record not only within the state. In future, if the person goes to any other state also, so the records can be seen from that thing, because health ID is a unique ID. It's like Aadhaar ID, right, for that individual. So it helps a lot actually from those angles. So that's
Yeah,
why health
yeah.
ID is mandatory and useful, and people should encourage your MOs, and now everyone should encourage to generate that and start using it. Okay.
So just a disclaimer that health ID can be created linked in the app, NCD app only using Aadhaar ID currently. That's the thing. You
Aadhaar
have to use
ID, and
Aadhaar.
you can only create this health ID in MO portal. Right now, it's not being in other portals.
MO
Your
portal and the corresponding PWA app, the MO app.
yeah, in the PW app, not in the CHO app, and not in the NM app, right? And
Yeah, yeah. So
Asha as well.
that is upcoming feature. So will be available down the lane in a couple of months in the NMCHO application also.
Correct. So it's in work in progress stage. So as and when we follow the protocols and approvals, we'll reach that. Okay, so this is all about MO portal, which has an app and your component of this thing. Any doubts here, Prashant? Any questions which has been raised which we need to address?
I think there are questions around this health ID integration. So they've been asking like if Aadhaar does not have a mobile number linked to it, what will happen? So that scenario is currently not supported. If you have a valid Aadhaar number and then a valid mobile number linked to it, only then the OTP will come. This is the current scenario. In future, maybe in the phase 2 or phase 3, we'll also provide the other features of like having your election ID card number or say PAN number basis health ID generation also. But right now we only support Aadhaar based and proper mobile map to it. So that is the only integration that's supported.
Okay, fine. If no other question, then we can move to the last section, which is the dashboard. So, Prashant? Prashant, you're there? Pinky, can you share me one state ID? WhatsApp me.
Sorry, dashboard ID?
Yeah, one dashboard ID for whatever
Yeah,
state.
yeah. I'm just sharing. Give me. HO
Are you
underscore
giving?
Rajasthan.
You're giving in a staging on or live?
Production, you can show HO underscore Rajasthan.
I think let's use MP,
Okay.
HO
Okay.
underscore MP.
Uh-huh.
Password, I'm just texting Sunish on WhatsApp.
Just WhatsApp me. Yeah. This is you have shared for MP, no?
Oh, one second.
Yeah,
That is
yeah.
for
No, so Karthik, let's show for Rajasthan because we have that state, district, taluka. 3 of them will show. Taluka ID also.
okay, okay.
I'm just
Can you
pinging
share?
Sunish the password. HO underscore Rajasthan you've written, right? The password is. Yeah, pinged.
Okay, so dashboard is the sixth step which I was mentioning in that entire workflow. Dashboard is a very important tool for the district, taluka level, starting from the taluka level, district level, state level, and the national level, to monitor the progress about how things are happening. If a policymaker or a decision maker is there and they want to see the progress or they want to see how it's happening, so they can always log into the dashboard and see. So this is how your dashboard looks like. It has major 4 indicators, the buckets, what you see, program analysis, disease wise, facility wise, and the user dashboard. So we are accessing right now the dashboard of Rajasthan state. So I click on the first green button, which is my NCD program analysis. So this is how the homepage looks like, where I can see the graphical representation of status with regard to this is population related, this is enrollment related. We have age, gender distribution, demographic map there. We have like CBAC related issues like what is the age group on which where we have number of people, alcohol related question, how many have said yes and how many no, how many not captured. So as a state monitoring officer, I would like to see how many not captured. If there are more tobacco consumption cases, I need to really take an action related to that actually. Okay, so this is how you can see the map in both the way, in the tabular way and the graphical way. Okay, so you can see on my right side, the right side is a screened reporting trends in last 1 year from June onwards till May. So in one nutshell, I can see, which month has fetched me good number of records. If you see last, in fact, Feb and the month of March as the highest number of records been entered, and I can see that the month of March has been highest. That's why it's highlighted in green. Okay, so the one which is highlighted in red is the lesser one,
Yeah,
the month
least
where the
screening done in that.
least screening done during that particular month. Okay, so this is how I can see the records in the dashboard. Key performance indicators, I can see again, it's the same set of standard what we are following in the MO, state, district, and taluka level. I can see how many enrolled, 30 plus, how many CBAC done, how many screening done for the first time, how many rescreen done, how many referred to the next level PHC. After referring to the PHC, what is the examination done for those cases? In that examinations done, like the 23 lakh examination done, how many diagnoses is done and how many are under treatment? And what is a follow-up adherence for the people who are under treatment? So as a decision maker, policy maker, monitoring or supervising officer, I will be interested in knowing these critical indicators to get into the monitoring aspect. I can see the same number of, the same thing in a tabular view also. Okay, so in the tabular view, I can see the district-wise breakup here. Okay, let's say I want to rank and see which are my best performing district. I'll go to the enroll and click on this button. So it will sort me from the highest to lowest. Okay, so in one view, I can see, okay, Sikar is my best performing district. Then comes Ajmer. Which are the bottom performing districts? I'll just scroll down and see, these are the districts which has been performing like that. If I want to see how many screened has been for the first time is there. So here also Sikar is one, Chittorgarh is second on thing, right? So similarly for all the other indicators, if I want to see the progress, I can go to I can just scroll down and see the records. I'll go to the next section, which is, let's say I want to see the MO examination part. Just a minute. Yeah, so I go there.
There's an arrow on the top, Sunish.
Yeah.
Yeah.
So I'll go there and I want to see the MO, let's say MO ka examination, how many is there? Okay. So where is that? Okay. Here, click on the examined. I will come to know which is the top performing state. So here I see Churu as a top performing when it comes to examination, right? How many diagnosed and under treatment I can see. So I can just click on it and see. For example, I want to see in this district, which are the top performing talukas. Click on the district name. So my next level will open. So in the similar way, this is for the state dashboard. So in the state, I can see all the districts, right? So when a district guy opens, he can see all the talukas or the blocks or whatever it has been called in your respective state. So I can see the drop down of all these blocks in this thing. I want to see which block I want to get inside. Let's say Taranagar. I click on Taranagar. I'll go below, one level below, which will give me the PHC level information actually. Under Taranagar, how many PHCs are there? What has been their performance? Under which PHC then the usage is good or usage is bad? Okay, so I have drilled down Taranagar. So these are under Taranagar, these are my PHCs, right? Let's see Satyu. Can see some numbers here. I click on Satyu PHC. I will go to the next level. So this level will give me subcenter and SWC subcenter level information. And if I click on the subcenter, I can go to the village level. So under that subcenter, see there's so many villages, subcenters are listed here. Okay, so I just click on it one, let's say whatever, a Dingy subcenter. I click it, I go down to the next level, which is my village level. So basically what I'm trying to say is at national level or the state level, I can drill down from the state level to the district level to the PHC level and below, even till the village level, and drill down and see what has been the performance. So this is how a monitoring officer can open the dashboard and check the details here. Okay, had the target population, this target and total population has to be updated from the backend. So once you update it, so automatically your percentage can also be calculated from in the thing. So this is how I can view the dashboard, number one. Number two, I want to see, there are a lot of filters which has been introduced. Again, this is, if those of you who have been working and seeing in this HWC domain for last 4 years, you must have seen this is a new dashboard, right? All the feedbacks, whatever we received in the first 3 years of our implementation and execution, we learned from those feedbacks and we developed this dashboard addressing the needs and the concerns coming from the field. Filter, I can filter it down based on whatever various options like HWCs or not, or all date-wise, gender-wise, district-wise, I can drill down. Let's say one of the important question was always asked, filter for the date. So let's say I take, I want to see only the performance for the month of May. I start as May 1, end date as May 10th. I selected it, I applied the filter, and I am trying to look in this month what has been my performance. So I can see the performance for this last 10 days of the month of May. Okay, so this is a new feature which was earlier not there. last 3 days or 5 days or whatever, I can select the date range and then come to that and then try to see the performance. So this is how a monitoring officer can see the performance of each. So 1.4 lakhs is enrolled. I can see the breakups, which district has done. The breakup story I've already shared. So we can drill down till the village level and see, and from the records been entered from which level and what has been the outcome. So this is how a person
We can also
see
download the data and show once. If you can
Yeah.
just initiate the
So
download.
that was another demand for download. So what I can do is that I selected thing, I click on the download, my report will get start downloading. So the report is downloaded. As you see on the left table data, click on it. Okay. So your Excel sheet will open. Sorry. Yeah. So what you can see here is page one is for the entire state. You want a breakup of this, go to the second sheet, which is your district. You will get a district wise breakup here. Okay. So this is how you download the data and can see. Okay. If I want to do some analysis here, I can go and sort it and filter it depending upon my whatever permutation combination I can do, just lowest to highest, and just see which district is doing well, which is not doing well. As a monitoring officer, I can rely on this data for doing this thing, monitoring purpose actually, right? So this is how you download the data. Okay, and then what else you want to show here? You have
And
certain
even in this
reports.
entire data, right? If you can just scroll down. Okay, reports.
Great.
Yeah. So
Yeah, you want to show them the tabular view?
yeah, in the tabular view, just wanted to call out that since there are so many columns, right? We've also given an option to customize the table as per your needs. So if you can, Sunish, show that custom option. So whatever columns you need, whichever indicators you need, whatever makes sense for your state, for your district, for your taluka, you can custom the table and download only that much data, what is needed.
Yeah, so I say I remove certain fields here. I don't want so many things. Just apply it. So now you will see my population, which was 0 here. I mean the total and the state population. I have reduced those screen, and only the relevant things I can see. This 4-5 things. If I want to download, click on download. The same data will get downloaded. Right. So this way you can customize your requirements as per your need, and then download the data or use the data. Okay.
Yeah.
And then you, in the similar way, you have disease-wise analysis. On the top, you see there are 4 major things. So in the disease-wise analysis, I can see for hypertension, diabetes, and this other 3 diseases, what has been the trend, in terms of, as you see on the right side, you see the trend for hypertension. On the left side, you see the funnel gap where we are saying, this many population has been enrolled. Out of this population, we have examined, screened so many people, 22 lakhs, and this was further referred to the next level. And what is the control group and what is the follow-up adherence to that particular cases who are under treatment. So this is the way I can see the funnel gap. On the right side, I can also see the trends in form of chart or the line graph, right?
Yeah.
So this is what year-wise
We
I
can
can
add,
see.
let's say, follow-up and control, and you can just click remove enrolled 30 plus and screened, just to show. Click, yeah. Click follow-up
What do you want?
adherence. Click follow-up
Yeah.
adherence there, and control,
So
the next one.
now you see
Yeah.
the follow-up adherence has gone up in last 1 year. Okay, and the control group also. So that's how you can do the requirement. Let's say I want to see the under treatment cases. How many under treatment are there? Against the under treatment, what is the follow-up adherence? Okay, so there are cases which are picking up. Last 1 year, the performance has picked up. That means you need further review, and you need to at the district level, you have to get into ensuring that this particular graph goes up by more and more follow-up to be taken care. So that is the action one can take. Okay. So this is one level. This is a graphical explanation of the same. Okay, do you want anything special to, I mean, specific to be addressed here, Pinky?
I mean, if time permits, we can explain sunburst. Not sure how much that will be useful.
One
It's
thing,
already
Pinky, like in the table, how do you use the expand all option? So if you
Yeah,
can
yeah,
show
let's show
that,
that once. Yeah.
in questions on that.
Yeah, so that's a very useful option. We will show you now. So what happens? We are logged in at a state level right now, and as Sunish showed you all, that at the state level in the tabular view, district-wise performance will be shown. So if at one shot I want to look at the performance of all talukas, I have the ability. So what I have to do is, so right now if I click expand all option, if you see there, yeah, if we click on that, all the districts, talukas of all the districts will be expanded in one go, and you can download this data for your further analysis. So this feature is available again at each level, state, district, taluka, wherein one skip level expansion ability we are giving at one go.
Okay, so you
Yeah.
see in the dashboard.
And if you download the data and show how it looks like for analysis.
So your data is downloaded. So this is the district level. The third sheet gets added is a taluka level. So you can see the taluka level details also here. Okay, so this is district, this is in Ajmer district, this is a taluk. So I can see the taluka level expand performance also. Okay, I can obviously sort it, filter it out, and then use it as per my requirements. Okay, so this is NCD program disease wise. We have certain reports which is been put up here. We can see the facility wise and user wise performance also as to how many has been active in last 1 month or last 7 days. You know, so as a
So
monitoring
this is
officer.
the user performance. We have like just started adding, like till now we didn't had the facility user performance in these dashboards, and we are adding it one by one for the different cadre of users. So this particular screen is for tracking the Asha users performance location wise. So this is basically the key program indicators for Asha, the enrollment, CBAC, and how many total number of Asha users are there per location wise, how many of them out of the total users are registered, out of the people who are registered, how many of them are active meaning are the Ashas who are active in last 7 days, and we are giving the ratios of active and inactive users. If you scroll right, we also show the location wise total population, the target population if it is available, and the enrollment and CBAC indicators. So the numbers which you are seeing, it is not the total enrollment of Rajasthan, but it is the total enrollment or CBAC done by only by Ashas in Rajasthan or in each of the respective districts, and we can drill down it location wise just like any other dashboard. So that way you get a clear idea of the performance of the Asha users, how are they doing in a particular location.
There are certain reports and some are in work in progress, which we are in the process of putting in, right?
Yeah, so the work in progress ones we can show, you can show the NPCDCS form 1 once over there in the report section.
Yeah, so once you click on the report, you have this NPCDCS report, which you can fetch. You have to select, let's say I select
You have to
on this
select a
side.
one. You select till a
So,
subcenter. So this is the form 1, NPCDCS form 1, which is filled at the subcenter level by the ANMs or CHOs. So that ability to generate that report, monthly one, we have given the ability right now in these dashboards. Eventually the ability will be added in the respective ANM CHO application also, the CPHC HWC app. So at a administrator level, the form 1 for any subcenter could be fetched by the state, district or taluka official. So eventually the plan is to add all the other forms, NPCDCS forms, the form 2, form 3, aggregated at a PHC level or CHC level or district level. So that is something work in progress, and we have the roadmap to be covered in future.
okay, so shall I show that yeah, you want to discuss on this? Or you've
Yeah,
already
so
shared?
yeah. So basically four main features are upcoming, which we will release this week. One is the Asha user performance, sorry, that we already showed you. It is already in production. So three main things which are coming out this week is Health ID report download, which right now Shambhuji is actually circulating in the WhatsApp groups, and you're getting in your state groups through the Tata Trust state coordinators. So these reports will now be, Health ID reports will be accessible by the state, district, taluka officials in their dashboard only. So they can easily download it from their dashboard. We have also added the ability to download the basically the cohort monitoring report. The cohort cumulative and cohort quarterly report are also available to download, and even the Asha user wise performance. So what we have shown you right now in the dashboard is the where you can, the officials can assess the location wise Asha performance, each user how much they have done. That detailed report also we are adding and will be out very soon this week. I can quickly share and show them in my pre-prod environment, like development environment. Shall I go ahead?
Yeah, you can show. Shall I stop the sharing or
Yeah, you have to.
is that screen? Yeah.
Okay. So let me know once you can see the screen. Is it visible?
Yeah.
Okay, so what we are talking about is this report section. All right, so here we will have these bunch of reports available. As Sunish have already showed you the NPCDCS report, which is available in the production. So rest of these reports are coming out. So Health ID summary report can be fetched directly. So I've logged in with for a Jammu and Kashmir like test account. So we can easily download this summary report. And I can show you this file as well. Yeah, so it looks something like this. Since this is a test account for this state, only one district has been created in the test environment. So this is how it looks like, the summary report. You can also download the detailed report, again state-wise. Yeah, it looks something like this. So for a state, for a district, for a taluka PHC sub-center, what is the count of the health IDs created or linked? So we have seen in the previous report, the count was 73. So that is matching, and the breakup also you will get easily. So these reports are being shared today over WhatsApp. So now the all the health officials can directly get it from the dashboards. So in addition to that, we are also giving the ability to extract these IHCI related reports. So we will be calling them cohort cumulative report and cohort quarterly report. So those are also available for download, and we can pick it for, I can pick a month, and the entire cumulative report based on that reporting period will be generated. So it looks something like this. So my reporting period I have selected is 22 Feb, and the cohort period would be all the different segments, right? So 3 months before that. So similarly, you can generate a cohort quarterly report. We can also generate a Asha user-wise performance, which I was talking about. So what is different in Asha user-wise performance? Each user-wise indicators could be tracked through this report. So for a state, for a district, for a taluka PHC sub-center, village, which are the Ashas who are working, whether they are active or not. Yeah, so they are if they are active in last 7 days, how many individuals they have enrolled, how many individuals enrolled are 30 plus, and the CBAC done by them. So at each user level, you will be able to get this report directly accessible in your fingertips through the dashboards. Yeah, any questions? I think that was it, Sunish. Those are the main three reports coming out in the report section, which will be live
Okay.
Thursday or Friday. Yeah.
Okay,
Back
fine.
Friday.
So, yeah. So as explained earlier, the dashboard, we had shared the dashboard for the state level. So I'll just quickly share you the dashboard, how it looks for a district level. So, sorry, this is a taluka level. So we have logged into one of the taluka. So in taluka, I can see what is the enrollment, and the same set, all the indicators, all the parameters will be same. So you can see the the hierarchy here, the state, district, and the particular taluk. So in that taluk, what are in the developments? Each facility wise, I can see CHC level. So what I'm trying to say is that taluka level official can also, the block level officials can also log into the portal, the dashboard, and then they can also do their own performance analysis and do the follow up or take the necessary course corrections to improve the performance. So all other feature remains the same. Only thing is that they can see only the specific taluka level details there. For district, they can see only for the district, state only for the state, national level, pan India, everything they can see. But all other features remains the same. Okay, so this is just, I wanted to highlight this taluka level and block level also. Yeah. So I think dashboard is also done. So we have covered the entire NCD life cycle. And if we have any doubts or any questions which we need to address from the chat, or if you can open up, it's already 2:15 now. So we can take up a couple of questions or whatever. So yeah. So Prashant, Karthik, is there any question from the chat we need to address here?
Sunis, I think one point we should talk about is that the privacy of the data. I think will be better to talk about it because there's been some confusion like who's having the rights to see which data.
Yeah, so the data, I mean, see, as you see in the dashboard, for example, let me start from the dashboard. So dashboard, you are seeing only the cumulative numbers. Okay, so you are not seeing the line listing of the patients here. Okay, so it's a very valid point. Data security is a major thing here. So we can only see the numbers at the dashboard at any level, national level, state level, or your taluka level. So we can only see the numbers what we are seeing here on the screen, right? When it comes to user, let's say medical officer or ANM or CHO or Asha, they can see the patient line listing of patients only for their facility, only for their jurisdiction. They cannot see other facilities data. And that's one of the primary reason why we don't allow multiple logins in one tablet or one device or one mobile, right? So to avoid all those things. So whatever records you can see at their level, at MO level or say a secondary level. At district level, at the dashboard level, you can't see. Admin level, you can't see. So the data is all safe in the server. Whatever data gets synced and all, it's all safely parked in your server, which we are using from BSNL and NIC. It's all taken care of. No need to worry about all this misuse of patient records and all, right? I hope it addresses or gives satisfied your question.
One question is, there is some gap observed between the beta version of dashboard and the older version of dashboard. So
yeah, Pinky, you want to
I would
address
like
this?
to just comment on that it's no more the beta version of dashboard. This is the whatever dashboard we are showing, this is the actual dashboard. And please do not refer to the old dashboard. It is not getting updated very frequently. Like slowly it is going to be decommissioned. So this is the only dashboard where you have to refer to.
Yes, so please start referring to the new dashboard. So the moment you rely on the old dashboard, slowly we'll phase it off actually. All the features from the old will come here and the new features will all be here only. So whatever your questions of data mismatch and all those things, I think once you start following one new dashboard, it should be able to address actually. And don't worry about data loss. It will never get lost because we haven't enabled any delete option either at the admin portal or the dashboard, only at the user level if they want to delete the records. If it's not referred and examined, that they can delete it. Otherwise, all the data records will be there in the server. So no need to worry about data loss. It will never happen.
So there are many questions related to wrong mapping, how to get the mapping corrected, or number of districts, etc. So for that, one simple answer for you all is, please make sure your request get raised at least with the state level NCD officers. From there, Tata Trust coordinators can be contacted easily and those could be sorted. But minimum, at least you raise it with your state coordinator. If you do not know how to do it, if the solution will be available at your end, your problem will be solved then and there by training you on that. If it requires higher level intervention from ITTSU, Tata Trust person will take it ahead and get it solved. But please make sure you raise it with your state authority.
Yeah, state or district, because there is an access for admin portal, so admin portal, we can do all the mapping related changes or whatever is required. So that can be taken care of. If there is anything beyond that, we can take care from the backend, right? So yeah, next question.
So earlier one question was there that in drug register there were no drugs, so they were not able to screen. So they too are not linked together. Care providing or recording the data do not depend on any other factor. You can screen individuals even if your drug stock register is not updated. So don't get confused. If require help, please let the state specific Tata person know, he will guide you.
Yeah. Any other question?
Rest all are repetitive question. One request was if we could share the PDF version or PPT of this training to them. So we have already shared with the states, but again we will reshare it with the state authorities or state NCD authorities, and from there accordingly district could then take it and can disperse it further to respective facilities and blocks.
Okay, so since the admin question was asked, I'll just quickly share you this admin portal. This is how the admin portal looks like, what you see on the screen. Basically, it has 4 features. You have to add, view, edit, and search the records. So for example, view, if I go and click on view, this is a dummy portal. So you just click on the name of the whatever taluk. You will see in this Bharatpur, I have so many DOs created. This is a data entry operator ID. Doc is for medical officer, doctor. And similarly, you have nurse. You see here nurse underscores is for the nurse actually. And you can go to the edit and basically select the taluk, whichever taluk. So automatically the next level opens up. Okay. Under this Bharatpur, which is the taluk you want to do. You want to edit the PHC or transfer the PHC, it can be done. Under that, you have to select the subcenter. You just select the subcenter. What you want to do for the subcenter, edit or transfer, that can be done, right? In the similar way, you can add the details here. If people are asking about the taluka and all, the mapping details, you can go and do this in the admin portal, right? So this is a hierarchy. So I want to add the user. Let's say user is subcenter ANM or CHO. I want to add. I can add. If I want to add village level, already 3 villages are added. If I want to add further villages, it's a new village created. Go and add the village and then search, add it. Okay, the last is search option. The search by user. User, you have all the users listed here: ANM, CHO, MO, DEO, staff nurse, Asha, lab technician, and pharmacist. We have disabled it off late. Otherwise, you can search them by the username or password or the mobile number. So in this case, I'm just randomly searching some records using some mobile numbers. So all the users with that username of mobile number will get listed here. Okay. So in real life scenario, you will not get, this is a dummy thing. We use the same mobile number everywhere. So this is how you can see search the patient in one go. You can see the user ID. What is the user type? Is it ANM? Is she VIA trained or not? What is the contact number? what is the last sync date, which facility, which parent PHC taluk that person belongs to, right? And towards the end, I can just click on this edit button, to do any edit. I mean, for example, I mentioned earlier that I want to change the mobile number. Click on that, go here. Okay, I'll do the mobile number, some changes here, and save the records here. Okay, that's how I change the mobile number. You are logging in, the ANM or the Ashas are logging in, the CHOs are logging in, OTP is not coming. Click on this OTP button. The OTP, once it gets generated, it will come and sit here for 5 to 10 minutes. After that, it will, as per the policy, it will go off actually, right? You can ask the user in front of them, you only to generate the OTP. You can fetch the OTP from here and put it in the mobile. So all this is the crux features what we can see in the admin portal. So not all of you will have the access. At the district level, we have created that cadre of master trainers and all, and the state level also. So we can reach to your respective district in charge. It will be taken care of. Or you have respective in your some of the states, we have WhatsApp group with all those people. So you can post in there also through the respective nodal officer of that state. We will get it sorted. So this is your mapping related question should be addressed at your level itself. Need not worry about all those things. Only thing is you have to approach the right channel and get it sorted at the earliest. It's very simple. You can do it at your level. Now the question of deletion is not available in even in admin portal. That has to be done from the backend. So that we have not given that access to anyone here. So that we will do from the backend. Otherwise, all the other things, whatever addition or edition or the search or changing the mobile number, adding the village or sub centers, creating user IDs, everything can be done at your level using this admin portal. Okay, this is in crux about admin portal. I hope that will address your concerns with related to mapping or creating whatever, IDs and transferring the ANMs and all should be taken care here. Okay. Fine. So, Prashant, next question. So just address the admin portal issues here. Anything else?
That question related to death, if one person has died, how that can be done through MO portal, that we need to show.
We just explained during our MO portal, we can click on the MO's
question is coming again 2-3 times it is.
I think we can share the recording as well with everyone. I think that will also be helpful. If they missed some feature.
If possible, we'll quickly show the priority follow.
So you address the next question first. और कोई questions है? Next questions.
Many people have asked they do not have Asha IDs available. So this ID is not being created by us. These IDs are government level IDs given by states. So I request you all, whether it is Asha or ANM, you reach out to your state level authorities and get your IDs. We would be able to help you in mapping.
Yeah, so this IDs, typically we use the RCH IDs for that individual, and that you can get it from the state or the respective district officials, and then you can use it actually. Okay, next question. By the time I feed these details.
And pick a case which is overdue for follow-up.
Yeah, see, okay, so you see the, now the question, what I'm trying to address is, the answer is how to upload that patient expired thing in MO portal. So what you need to do is log into MO portal, go to your work plan, okay? Click on the follow-up option. So you will see the line listing of patients here. Amit, Paul, Rakesh, as you can see in the screen, right? So what you do is that towards the end, the action button is there. Okay, so click on that. You will have these many options as to fill. Migrated है या वो private में चला गया या not responding, वो चाह नहीं रहा है कि यहाँ से services ले या patient expire हो गया. What you need to do is a patient expired and you want to close the follow-up. Yes. तो वो अमित जो है follow-up list से आपका बाहर चला जाता है. So the patient is dead. So that's how you do the necessary changes in the MO portal. I hope we have answered your question.
Another question Sunishji was raised is, in the current dashboard, on the disease wise, we are able to see one disease on one page only. Whether is it possible to get data of 2 or more diseases on the one page? Otherwise, it is difficult to move on separate screens.
Pinky, you want to answer it? See, it becomes when you put one hypertension, you will see the entire, the subsets.
Yeah, the
of that
journey
in
of
one page.
hypertension, right? Yeah. So if
Yeah,
we
so-
can introduce all the diseases, but then it becomes very difficult to manage that entire table. We can try that if
Yeah.
that is the need, but yeah, based on the
Correct.
We
need.
can provide for the
think of-
download report section all the disease data in one go for the table thing.
Okay. Okay.
Yeah, because see, for example, if you see the thing here, so in one page you can see the hypertension. Under that you can see the entire journey from enrollment till the enrollment and that examination, screening, diagnosis. Like that you can see below. If you make all the disease together, it will become very this thing. What do you say? Congested kind of thing. So for
Yeah,
viewing
it will become very
purpose,
bulky. Yeah.
yeah, and when you are viewing it, it will not help you, right? So that is a logic why we have not given that.
Yeah, maybe we'll try for download. We'll get back on that.
Yeah. Okay, next question.
I think a bunch of them on admin, right? How to delete some unwanted subcenters from admin portal.
So yeah, so admin, I quickly showed you that. As I said, you can rename them. You cannot edit it. If you want to delete it, just send us a list with the full hierarchy. When I say hierarchy means district, PHC, I need a proper mapping. District, PHC, which subcenter, which village, whatever subcenter you're talking about, that needs to be deleted, that needs to be whatever. So that if you send us an Excel sheet from the backend, we'll get it done for you. The deletion. We have not enabled any form of deletion in admin portal. Right. Next question.
So Pinky, there is question like in NCD format, it covers suspected cases, new cases, and known cases or follow-up cases. How to extract these specific details separately?
Sorry, come again with the question.
So in NCD formats, they ask for how many are suspected cases, how many are new cases, how many are old or known cases, how many are follow-up cases. So how this bifurcation they can get from dashboards?
So the person who are, what is the first one you told? The new cases, known cases, follow-up cases, and one more suspected cases,
Suspected
right?
cases.
So suspected cases are nothing but the referred cases, right? I mean, the number of people who are referred for a particular disease. Referred by screening, basically. So that is your suspected cases. The new cases
Referred
are
and not diagnosed. Referred and not diagnosed. Yes.
yeah, but at least referred, right? I mean, you suspected and you were referred. So that count could be used. Follow up, as such, we are showing the basically right now to start with, we are showing the follow up adherence. That means the set of individuals who are being seen at any facility, be it a PHC or be it a subcenter in last 3 months. So that is what we are showing currently as follow up adherence, whether you are regular for your follow ups or not. But on a monthly basis, yes, we can add those things like how many follow-ups completed in a month and so. But in the reports, we plan to generate them. So all your NPCDCS reporting formats, right? Eventually, all of them will get into the dashboards only. So you will be able to generate all of them, and we'll make sure we map the correct indicator for the columns.
And one last question we can take is, can we have breakup under examined and referred section? Like how many are examined and referred for the different NCDs? So on the disease specific page, you would be able to get those numbers.
Yeah.
Disease specific numbers are there on the dashboard. So
Yeah.
This is it. For follow-up cases, after how many weeks can we ask patients to come for follow-up? See, that decision entirely is up on the medical officer. Like for after giving treatment once, how long he want the patient to get on the treatment or on the advice, and after how much time he wants him to back. Though the guideline asks at least minimum after 1 month, they must call them, because medicines are given only for 30 days. But in the end, it is decision of medical officer. Guidelines are minimum 30 days.
Yeah, so guideline says that once in a month for your A&M and CHO level and once in 3 months for medical officer. However, you can always change the follow-up criteria in the portal. When I was showing you the follow-up that page of MO when they're in the treatment page, they can always set the follow-ups actually, for 1 week or 1 day or 2 day or whatever, 10 days depending upon the patient's condition actually. Okay, next. If not, then
Yes, this is it.
this is it. Okay, Karthik, Pinky, you want to add anything here? Otherwise, we can ask NHSRC to conclude it. You have shown this thing also, no? Key updates and all other future upcoming.
Yeah,
We have
yeah.
showed
I
this.
mean, we are getting a lot of questions. It's like tsunami of
Yeah,
questions.
that's good.
We
Yeah, so
we
the
hope we
time
are
is.
able to make justice for most of them, but yeah, whatever is not answered or we would have missed, excuse us for that. And please reach out to the Tata Trust state coordinators, district coordinators, whomsoever you can reach out to get your queries resolved. We are there to
Yeah.
support.
If you want a further detailed training or, for your staff at the state or the district level, as we have been doing, that can also be taken up again. If you want a detailed demo, if you want personally in your mobile to see how it is and all, dummy IDs can be shared for you to access and, play around with that to get a hold of it. So all those things can be taken care of. Just get in touch with your respective state, whatever, the Tata Trust coordinators or us, and then we will try to address your concerns as far as possible and try to make things easy for you. Yeah. Okay. So I was just reading some of the chats. Yeah. Okay, fine. So we have addressed all those things. So please get in touch with us because time is a concern here. So we can definitely reach out to you and you can reach out to us whatever way, and then we try to make things simpler. Yes, thanks a lot for your patience and wonderful questions you have been asking. Very insightful for us also. We learn a lot while discussing with all of you. So wonderful. Thanks a lot. And over to NHSRC, Dr.
NHSRC.
Neha. Dr. Bala, please. So I'll stop sharing.
Yes, so thanks a lot, Mr. Sunish from Tata Trust, Pinky from Dell, Mr. Karthik, Mr. Prashant, and my NHSRC colleagues, Dr. Neha and Mr. Dharam Singh. So I think we have addressed most of the queries which were raised by all the participants, and we would really like to thank you. It was a very wonderful and very interactive session, and I hope our field level beneficiaries and healthcare providers will be able to robustly implement this application. So, just my quick question to Mr. Sunish or Pinky from Dell would be, it would be good if we can provide them with, provide the field level health decision makers with the support email address, so that in case if they have any questions or they require any clarifications, they can get back to you. So, hello?
Yeah, we can do that. We can share our email IDs in the chat box. If they want to reach out to us, we can do that. And then anyway, respective state Our nodal officers, they can do. I'm just typing. Pinky, Karthik, you can also share your email IDs. If they want to share, they can definitely
Yeah.
reach out to us. Yeah.
And also we have a WhatsApp group for each and every state, so they can easily
Yeah.
post it there. We are also like active there on this groups also.
So most of the states we have this master trainers whom we have trained. I mean, and then there's a WhatsApp group for them, so they can post their queries. So usually they do that, and we get back to them in that group and address it. So anyway, I've shared my ID, so others can also do. Yeah.
ठीक है. Thanks a lot, Mr. Shunish, and the Tata Trust and Dell team. And thanks a lot to all the participants, because today we had, we can still see there are still many participants, and this program was also streamed on YouTube. Even on YouTube also we had a very great connections, as we can still see. So thanks a lot, and we hope and we wish everyone a very wonderful and pleasant day.
Okay. Thank you. Thanks a lot.
Thank you. Thanks a lot.
Thanks a lot, everyone.
Thank you.